Good evening, guys. Hope you all are fine. Good evening, guys. Yes, so Danish, Nilesh, Dr. Swami, Dr. Taslima, Nilesh, Sanjay, Dr. Nilesh. Good evening, guys. Hope you all are fine. So, good evening to all of you. Yes, so hope all of you are here, beta. And let us just start our session of the 25 most important clinical type MCQs that may be asked from biochemistry, my dear friends. For the upcoming 30th of July exam, these are the most important one that we will be targeting. Right. So without wasting time, let us move to the first question, beta. I hope all of you have joined. Still, some of you are joining. So I will just hold on for one more minute to just quickly allow all the remaining students to join. So hope all of you are okay, beta. Try to focus. Yes. So yes, tactile hallucination as well. Yes. Please join, beta. Mahi, Shyam, Dr. Divya, Kanupriya, Naveed. Yes, so hope all of you have joined back, beta. So let us start our today's session of the 25 most important clinical type questions for our 30th July FMGE exam. Yes, so without wasting time, let us move to the first question and try to target the first question over here, my dear friends. Yes, showing you the first question, beta. Showing you the first question. Please have a quick look of this question. Please have a quick look of this question. Please allow some time to read the question carefully and then we will be coming up with the answer. Vijay, thank you so much. So, waiting for the students to quickly join and let us try to target our first question of this session. First question of this session. Yeah. So what we can see here, there is one guy called Mr. X who is a young traveler hailing from the northern states in India, is planning for a trip to an area in southern states in India where there is malaria endemic, my dear friends. The malaria is endemic over here. And subsequently he was given anti-malarial drugs for the prophylactic purpose even before he had made the travel. And unfortunately, after giving the anti-malarial drug, the patient develops hemolytic anemia. Hemolytic anemia, my dear friends. Which of the compounds less than normal level will be the most common cause of this? Yes, yes, my dear friends. All of you are coming up with the answer. Yes, so many C. So many C I can see here, beta. Read the question carefully, beta. The correct answer to this question, my dear friends, is the reduced form of the glutathione. Yes, yes, so many C. So many. This is the correct answer to this question, beta. Reduced form of the glutathione, my dear friends. ध्यान देंगे इस चीज को. Yes, all of you can see this, beta. C. Yes, yes. So many C. So many C. Sanjay. Yes, yes, my dear friends. Ramesh. Yes, the correct answer is C, beta. ध्यान देंगे इस चीज को. Let us try to quickly target this question. We have discussed this during our classes at MIST. Try to focus here. We have also seen this pathway. Yes, coming down to show you the pathway, beta. We have talked about a pathway called HMP shunt pathway, my dear friends. And in the HMP shunt pathway, we have also discussed that the rate limiting enzyme was the G6PD, and G6PD, my dear friends, was giving you this guy, this compound called as NADPH plus H plus. And this NADPH plus H plus, my dear friends, this is giving rise to this compound's production that is called as oxidized glutathione was getting converted to reduced glutathione over here. ध्यान देंगे इस reaction को बेटा. This compound is called as reduced glutathione. This compound is called as reduced glutathione. NADPH plus H plus had got two hydrogens, and these two hydrogens are given to the oxidized form of the glutathione by the union of these two H with the GSSG. As you guys can see over here, that this GSSG is combining with these two hydrogen coming from NADPH plus H plus, and it is getting converted to two molecules of GSH. And these two molecules of GSH further will be helpful in detoxifying this guy called as H2O2, my dear friends. That is the hydrogen peroxide. That is the hydrogen peroxide. So try to look here, beta. This is the hydrogen peroxide that we can remember. If you add two hydrogen with this guy over here, these two hydrogen will combine with this H2O2 and it is going to form us two molecules of H2O. We can easily understand this pathway, beta, that agar aap log two hydrogen, if you are allowing with this addition of H2O2, then it will be forming the two H2O molecule, and this two hydrogen addition to break down this H2O2 molecule, it is done by an enzyme called as this glutathione peroxidase, my dear friends. So glutathione peroxidase is actually responsible for the detoxification purpose, but important point to be noted, my dear friends, it is getting this two hydrogen from this guy that is called as reduced glutathione. This GSS, we can also write it like this, that it is getting two hydrogen of this guy. These two hydrogens are coming initially from this NADPH plus H plus, and these two hydrogen are also getting combined over here. H and H are together combining with this beta, and this is forming GSH, and this GSH, by giving these two hydrogen to the H2O2, it will be finally getting converted to two molecules of water. So this is the compound, my dear friends. Reduced glutathione is the guy that can basically give us this hydrogen that can be added with this H2O2, and this can be also detoxified by this one. So this is the question that they had asked, beta, that the most likely cause of the hemolysis is a less than normal level of which of the following. Just now we have seen reduced form of the glutathione, which was written in the MCQ as GSH. This is the guy that was actually causing the detoxification by the help of the enzyme glutathione peroxidase. Try to remember, my dear friends, important expected question that can be cast in the upcoming exam. So FAD, my dear friend, it is helping in the conversion of the NADPH plus H plus to add this two hydrogen with the GSSG to form two molecules of GSH. And the second enzyme, glutathione peroxidase, is the one that is again going to break this H2O2 to form two molecules of water. I hope there is no confusion in this one, beta. So this can be asked as a new type of clinical type question, that reduced glutathione concentration should be made at optimum concentration within the RBC, so that this does not lead to hemolysis. So this portion that we have discussed over here, this is a special pathway within the RBCs, beta. Special pathway within the RBCs that will prevent us from hemolysis or from hemolytic anemia. We have also discussed glutathione peroxidase enzyme is dependent on this important cofactor that is called as the selenium. That is called as the selenium, beta. So ध्यान देंगे इस चीज को. It is selenium, and this with this enzyme together is causing the detoxification of H2O2. Detoxification of H2O2 to form two molecules of water. ध्यान देंगे इस चीज को, बेटा. Right? Hope all of you have got this one correct. Let us move to the next question over here. This is a part that we have discussed during our classes under the HMP shunt pathway. Under the HMP shunt pathway. ध्यान देंगे. Please try to focus in this one. Right. Moving to the next second important question over here, which I feel is more important for our FMGE exam. Try to look at this question. Yes. First, give it a good reading. Take your time. No need to rush, and try to understand over here. Read the question carefully, beta. They have asked about the most likely diagnosis. So we need to read the question in this regard. Yes. Right, beta. Important point, try to focus here. Yes. So hope there is no problem. Try to focus. Yes, waiting for the answers, beta. Waiting for the answers. Try to look here. Neonate. My dear friends, 4 days after birth suddenly becomes lethargic and starts refusing breastfeeding and vomits during the forced breastfeeding. There is a word called here as refusal to suck. Refusal to suck, my dear friends. Please remember the key word over here. Yes, all of you are right, my dear friends. All of you are right. Yes, this is the refusal to suck the breastfeeding and also vomits during forced breastfeeding, but accept the plain glucose water mixture. Accept the glucose water mixture as reported by the accompanied mother. The mother also adds that the baby had developed diarrhea on the day 3. Diarrhea on the day 3. Clinical examination reveals that the infant had developed pot belly also due to hepatomegaly. Please try to look here, beta ji. Although you are seeing the word pot belly over here, don't get confused, beta. Although you are seeing pot belly, we have studied that pot belly can also be seen in the patients of von Gierk disease. But please remember, in the von Gierk disease, you do not have such history like refusal to suck breast milk and acceptance of the glucose water. ध्यान देंगे बेटा, von Gierk disease, my dear friends, is a disorder of hypoglycemia, where the baby in between feeds will develop fasting type of hypoglycemia. But here, whenever the child is breastfed, then there is a problem to refusal to suck the breast milk and there is acceptance of the plain glucose water. And urine routine examination, beta, RE stands for routine examination of the urine, also gives you some reducing sugar in the urine, and reducing sugar in the urine can also be seen either in glucose or with galactose or with fructose. In this case, it is galactose, my dear friends, that is coming in the urine causing galactosuria. This can be detected also by Benedict test. Yes, Benedict test can be also helpful to detect this reducing sugar in the urine, my dear friends. Yes, so answer to this question without any doubt, my dear friends, will be galactosemia. Yes, all of you have answered this correctly, beta. All of you, clapping for all of you, my dear friends. Yes, GAL1 put deficiency, GAL1 put, galactose 1 phosphate uridyl transferase, galactose 1 phosphate uridyl transferase deficiency, my dear friends. So try to understand, my dear friends. Divya, in this case we have to remember, beta, although you are maybe thinking this in the question in the line of the von Gierk disease, ध्यान देंगे बेटा, although there can be von Gierk disease, see, please try to understand this particular word pot belly over here. This word pot belly, ध्यान देंगे बेटा, this word pot belly might also be seen in the patients of von Gierk disease, beta. But in von Gierk disease, my dear friends, in patients of von Gierk disease, we basically present with fasting hypoglycemia, there might be lactic acidosis, there might be also increased in the ketone body production, there can be also increase in the level of the uric acid, there also can be hepatomegaly, my dear friends. That is also seen in patients of galactosemia also because of too much of deposition of the galactose 1 phosphate in the liver. There might be hepatomegaly as well. Also remember, there are high chances of xanthoma formation, and we also have a hallmark finding called as doll-like faces. Doll-like faces. And due to this hepatomegaly, we also do get pot belly. Yes, all of you are right, beta. The enzyme deficiency for the von Gierk disease is glucose 6 phosphatase. So more glucose 6 phosphate will be there inside the liver, and the pathway can be also diverted either for glycolysis or even for the HMP shunt, where it will also go for the production of uric acid because it will produce PRPP or the phosphoribosyl pyrophosphate. That is a precursor. That is, my dear friend, a precursor for the purine synthesis. So von Gierk disease, mainly you will be seeing such features. In von Gierk disease, my dear friends, there is hypoglycemia. Please try to understand, beta G. Don't get confused. There is hypoglycemia. In the blood, glucose level is going to get decreased, hypoglycemic condition. So as the glucose level in the blood is decreased, the blood is not having enough glucose, so there is no question of glucose coming out in the urine in patients of those von Gierke disease. Read the question carefully. How, where we are able to differentiate them from each other. Von Gierke disease patient में due to glucose 6 phosphatase deficiency, we have got hypoglycemia. That is the most common feature. Although there is pot belly, बेटा जी, but ध्यान देंगे, अगर hypoglycemia है, glucose is already low in our blood, how can it come out into the urine? So there is no glycosuria seen in von Gierke's disease. Glycosuria is mainly seen in diabetic patient, but in this case, although you are seeing that there is a reducing sugar coming out in the urine, but this reducing sugar, my dear friend, it is not the glucose. In this case, it is the galactose in urine. Yes, it is the galactose that is coming out in urine, and this galactose also can make the Benedict test positive over here. Yes, this is the galactose making the Benedict test positive, not glucose that is making the Benedict test positive. So important point, इसको ध्यान देंगे. Please try to focus here, beta. Important point, try to focus here. Important point, ध्यान देंगे. This is galactose in urine making the Benedict test. BT stands for beta Benedict test. One of you have some doubt? Please, I am writing the full form for you, beta. BT stands for Benedict test. That is positive in galactose in urine. So these features that we have discussed over here, beta, that is mainly pointing towards the galactosemia. Yes, all of you are right, my dear friends. In galactosemia patients, we can also see that there is oil drop cataract in our eyes. That is due to the deposition of the galactitol or dulcitol that we have discussed during our classes at MIST, right? Yes, important point. ध्यान देंगे. Benedict test, try to remember, it is galactose in urine, but in diabetic glycosuria, that is glucose in urine. Von Gierke disease, patients present with hypoglycemia, no glucose in blood, so it can't come out in the urine. So this is the differentiating feature. Confusing feature they had given was the pot belly due to hepatomegaly. Pot belly, please try to understand, it can be also seen in patients of galactosemia. Yes. In galactosemia, there is deposition of galactose 1-phosphate in the liver, and this gradual deposition of galactose 1-phosphate in the liver, it is also going to enlarge the liver that can present with this hepatomegaly. So don't get confused. This is an overlapping feature between beta two disorder, von Gierke disease as well as in patients of galactosemia. How do we differentiate? By the help of this hypoglycemia. Hypoglycemia में von Gierke disease में no glucose coming out in urine. Here too much of galactose will be there in the liver, that will be leaking out from the liver, it will come out through the urine. In the urine, Benedict test positive, right beta G? Primary lactose intolerance, secondary lactose intolerance, I told you this should be differentiated with the history of diarrhea. With the history of diarrhea, my dear friends. If lactose intolerance is mentioned, ध्यान देंगे बेटा, try to focus. For lactose intolerance, the most important line that we have to focus is that child immediately cries after breastfeeding. ध्यान देंगे बेटा, child immediately cries after breastfeeding. Child immediately cries after the breastfeeding, beta. In case of lactose intolerance, this is the point that we have to remember over here. This is the point that we have to remember. ध्यान देंगे इस चीज को बेटा. Child immediately cries after the breastfeeding. There will be abdominal cramps. Yes, there is abdominal cramps. This is the major challenge in patients of lactose intolerance, beta. Learn how to differentiate between this lactose intolerance from galactosemia. We have also studied, beta, lactose intolerance can be either due to the almost near to where the lactase enzyme will be almost completely gone. In those cases, my dear friends, it is better to avoid the breastfeeding. It is better to avoid the breastfeeding in patients of primary lactose intolerance. Yes. In primary lactose intolerance, please remember, breastfeeding is contraindicated. Breastfeeding is contraindicated over here. Yes, in galactosemia also, my dear friends, breastfeeding is contraindicated. Yes, in galactosemia, that is due to GAL1 put deficiency, as well as in primary lactose intolerance. In both cases, breastfeeding, my dear friends, will be contraindicated बेटा. ये contraindicated होगा यहाँ पर बच्चे को दूध नहीं पिलाएंगे, ध्यान देंगे. But if it is a case of secondary lactose intolerance, my dear friends, which is mostly secondary to diarrhea, because in diarrhea patients we have discussed there is loss of villi, and due to loss of villi in secondary lactose intolerance, lactase enzyme also to some extent will be lost due to the loss of folds, loss of villi, because lactase is mainly found in the folds. As there is diarrhea, there might be loss of lactase, but some lactase enzyme is still active. That's why in the secondary lactose intolerance, my dear friends, breastfeeding is encouraged. Let me write it in green color for you guys. इसमें breastfeeding is encouraged. इसमें breastfeeding is encouraged. ध्यान देंगे बेटा. Please try to understand this. Secondary lactose intolerance we have to give. Yes, all of you are right बेटा. क्या बात है? Please try to understand. Karishma, Jish, you are all right. Yes. In secondary, there is encouragement because whatever leftover activity, बचा कुचा जितना भी lactase का activity है, let us use this. Because nothing can be replacing the normal mother's breast milk. Please try to understand. Maximum DHA is coming from mother's breast milk itself. So if there is a chance to breastfeed the child, we will go ahead with the chance, and it should be encouraged. How do you differentiate from primary from secondary lactose intolerance? Primary lactose intolerance may usually there is not much history of diarrhea. Lactose intolerance, child is not crying due to the diarrhea. It is mainly due to the abdominal cramp. But if there is a history of diarrhea given, diarrhea is causing, then it is better to go for secondary lactose intolerance, and here breastfeeding is encouraged. Yes. Kanupriya, you are right. 5 to 10% of the lactase activity is present in case of secondary lactose intolerance. So, ध्यान देंगे बेटा. This is very, very important, and do not miss these 4 beta. These 4 are the confusing ones from the inborn error section, from where usually questions are asked. Von Georg disease, expected question. Lactose intolerance, expected question. Galactosemia also, my dear friends, expected question. ध्यान देंगे बेटा. इन तीनों को differentiate करना आना बहुत ज़्यादा important है. So try to remember the major hallmark finding in the Von Georg disease. One of you was also putting a message related to the culprit enzyme for oil drop cataract. Culprit enzyme for oil drop cataract. Culprit enzyme for oil drop cataract बेटा. इसमें answer will be marked as aldose reductase. इसमें it will be marked as बेटा aldose reductase. Read. Please read the question carefully, my dear friends. What they have asked. If they have asked the cause of the oil drop cataract, then it is aldose reductase. But if they have asked what is the enzyme deficiency leading to galactosemia, then the answer is this GAL1 put deficiency. This is GAL1 put deficiency, which is more common than galactokinase. Galactokinase deficiency. 2 major enzymes, both of them can lead to galactosemia beta. Both of these names also has been recently asked in your exam to confuse you. Better answer GAL1 put, because that is the most common cause. Second most common cause of galactosemia is this enzyme deficiency galactokinase, with which the galactose breakdown starts in the liver. अगर liver में breakdown नहीं हुआ तो बच्चे को दूध पिलाने के बाद galactose will not be able to get metabolized in the liver. From the liver it will bifurcate to the blood. From the blood it will go to the also eyes. And in the lens of our eyes, my dear friends, we have this culprit enzyme called as aldose reductase, and this basically convert galactose to get converted to galactitol, which is also called as dulcitol. So this is the toxic compound, my dear friends, that is actually getting deposited in lens. This is the toxic one that is getting deposited in lens beta. So read the question carefully. Galactosemia में there is deficiency of either of these two enzymes, GAL1 पुट या फिर गैलेक्टोकाइनेस, जिसके कारण लिवर में गैलेक्टोज का ब्रेकडाउन नहीं हुआ और एक्सेस गैलेक्टोज इज चैनलाइज्ड टू द लेंस। लेंस में जाने के बाद ये लेंस में ये एंजाइम है एल्डोज रिडक्टेस, दिस इज प्रेजेंट इन आवर लेंस, this is present in our lens, and in the lens it will convert the excess galactose, this will convert the excess galactose to get converted to galactitol, and that will get deposited and that will be the cause of oil drop cataract. Yes, ध्यान देंगे, usually in galactosemia patients the first hint that we can also remember, yes Kanupriya, you are exactly right beta, also ध्यान देंगे, the two major important point is the presentation at what day. We have also seen here the child basically neonate basically present 4 days after birth, yes, day 4 or day 3 after birth, and also had developed diarrhea on the 3rd day. ध्यान देंगे, diarrhea history is given. They are trying to get you confused with lactose intolerance, but we need to filter it out. Try to understand. This is a very important question that might be asked in the upcoming exam, my dear friends. There is a history of diarrhea, but the diagnosis here is not secondary lactose intolerance, because here they have not mentioned about the primary feature of lactose intolerance, that is the immediate cry after breastfeeding. So with that word we are going away from lactose intolerance. Then there was a confusion between von Geertz and galactosemia, hypoglycemia, glucose can come out in urine, genetic test is not positive due to glucose or glycosuria, that is mainly due to galactose coming out in urine. So like this we can reach to the correct diagnosis. Yes, ध्यान देंगे, ध्यान देंगे, ध्यान देंगे, important point beta. So usually lactose intolerance problems are seen whenever the child is breastfed. Child immediately cries after the breastfeeding, but this sort of crying is never ever seen in patients of the galactosemia. Rather, a few days after birth, they will refuse to suck the breastfeed. They will be refusing the breastfeed. You can't breastfeed this child. That's why mother will be forced to bring the child early to the pediatric emergency. Lactose intolerance में, although the features are present after breastfeeding, but mother will be keeping on breastfeeding and the child will be keeping on crying for few more days extra, so they will be brought little late. But in this case the mother will be forced to bring her child immediately to the emergency or pediatric emergency. ध्यान देंगे बेटा, I hope there is no confusion, you guys can able to relate to this. ध्यान देंगे. Yes, medicos, you are right. In this case the child will accept glucose water. ध्यान देंगे बेटा, child will accept glucose water mixture, that is also mentioned over here, that is also going in favor of galactosemia, right? ध्यान देंगे, dextrose solution is given, that is the glucose water solution beta, same way it can be asked. ध्यान देंगे, try to remember this. Coming to the next question. Please have a good look at the question and take your time to understand and mark the answer correctly beta. हड़बड़ी नहीं करना है. In the exam enough time will be there. You can definitely read the question in full. Try to focus. Yes, Chandar, next question. Yes, that was an important one, that's why we have taken some time over there. Yes, try to focus here. ध्यान देंगे इस चीज को. Okay, let us read the question beta. Miss Y, a 42-year-old lady working as a school teacher, presents to the endocrinology OPD with hot flush of the face. There is chronic hot flush of the face, and there is also signs of pulmonary edema and pellagra. Yes, even before I have read the question, the answers have come, my dear friends, my dear friends. Yes, yes, yes. It is all of you are correct, my dear friends. The answer over here is this. C, guy over here. The answer over here is C. That is the 5-hydroxy indole acetic acid. Yes, 5-hydroxy. All of you are correct. All of you are correct, my dear friends. 5-hydroxy indole acetic acid. Let us try to understand, those who are hearing, looking here. Try to look here, beta. So endocrinology OPD with hot flush as well as signs of pulmonary edema, and also an hallmark finding that is given here as pellagra. Further workup was done and it revealed that a non-malignant ovarian teratoma with argentafin cells in large number. Obviously the surgery was performed because there was a teratoma, and after that all the features had disappeared, and the excretion of a metabolite that was initially done but now it has become normal. So which of the most likely compound was earlier excreted in higher amount in the urine? We have already studied beta in a disorder called malignant carcinoid syndrome. ध्यान देंगे बेटा, in a disorder of malignant carcinoid syndrome which is also called as argentaphenoma. In this disorder we have discussed that here, try to focus beta, 60% of tryptophan is taken towards serotonin production. So in these patients of argentaphenoma, argentaphin cells are normally found in our GI tract, and argentaphenoma is most commonly originating from the ileum. We have also discussed argentaphenoma is mainly coming from the ileum, but in this particular MCQ, my dear friends, they are not talking about problems arising from the ileum. They are talking about teratoma, because in teratoma we have 3 germinal layers. So these argentaphin cells can also be seen in the teratoma condition, and due to this they are also increasing in higher number and they are also producing too much of serotonin. So in these patients also the serotonin concentration, my dear friend, it is increasing, and this excess serotonin will be further broken down by an enzyme called as MAO. MAO stands for monoamine oxidase, and due to this monoamine oxidase, this serotonin, my dear friends, will be converted to 5-hydroxyindole acetic acid. 5-hydroxyindole acetic acid, जिसको शॉर्ट में हम लोग याद रखते हैं as 5-HIA. For this estimation in the urine, this 5-HIA will be finally coming out in the urine, my dear friends, and in the urine this 5-hydroxyindole acetic acid estimation can be done in patients of the carcinoids or in patients of the argentaphenoma. Although carcinoids are mainly coming from GI tract, but here it is not from the GI tract, it is from the ovarian teratoma, my dear friends. 5-HIAA in the urine, usually if it is more than 500 milligram per day in 24-hour urinary output collection, अगर पूरा 24 घंटे के दौरान during the micturition more than 500 milligram per day is usually seen in the collected urine sample, then that will be diagnostic of this argentaphenoma. And once the surgery was performed and the teratoma was excised off, this 5-HIAA also becomes normal, because under normal circumstances, my dear friend, only 1% tryptophan should go for serotonin synthesis. So जब surgery was performed, then 5-HIAA will again come back to normal, and only 1% of tryptophan will give you only some serotonin. Some serotonin will not lead to overproduction of this much high level of the hydroxyindole acetic acid, right? So ध्यान देंगे बेटा, जिस you are exactly right बेटा, more than 500 milligram per day is for the 100% confirmation. Even if it is crossing more than 300 to 350, still we can go for the diagnosis, but MCQ answer is more than 500 mg per day in the 24-hour urinary output. Either you have to admit the patient, put some Foley's catheter, get him lying down in the ward, or if he refuses admission, give him a 2 to 3 liter of jar and ask him to pass urine in that jar only while he is seated in the home. ध्यान देंगे बेटा इसको. Try to focus. Argentaphenoma, 5-hydroxyindole acetic acid is the answer to this question, my dear friends. Yes. Please remember, FIGLU in urine. FIGLU in urine, it is a marker of folic acid deficiency or B9 deficiency. Beta, ध्यान देंगे. We should not also forget about FIGLU, although nowadays it is not much done, but for the exam sake they might ask you this question. Folic acid deficiency में हमारे पास मूत्र विसर्जन के दौरान माय डियर फ्रेंड्स, ड्यूरिंग द पासेज ऑफ द यूरिन देयर विल बी एक्सक्रीशन ऑफ फिग्लू. यस, इंपॉर्टेंट पॉइंट ध्यान देंगे बेटा. फिग्लू इन यूरिन is seen in B9 deficiency और folic acid deficiency. ध्यान देंगे इस चीज को बेटा. राइट, 5-hydroxyandole acetic acid is the answer to this question. Yes, moving to the next one बेटा. ध्यान देंगे इस क्वेश्चन को. Try to look here. Yes, important question. Try to focus. Yes, please have a look at the question and then go for the diagnosis. Right. ध्यान देंगे इस चीज को बेटा. ट्राई टू लुक हियर बेटा जी. यस, waiting for you guys to answer up. Yes, let me help you in reading the question. 42-year-old female, rural health clinic, generalized weakness and itching all over the body. There was a single episode of vomiting and there was yellowish discoloration of the sclera. She also underwent the routine blood investigation along with also LFT, and in the LFT total bilirubin was 5.6 mg%. Out of that, conjugated was 3.6, unconjugated was 2%, my dear friends. Serum alkaline phosphatase was on the higher side, that is our 427. Normally it is normal up to 125 units per liter. AST was raised little bit and also ALT was raised, and GGT was also raised here along with ALP. Yes, my dear friends. Answer is not Gilbert syndrome over here. Yes. Now, Nilesh, Yogesh, Divya, Harshal, Rajendra, Nahid, yes. Also, Sana also had answered it correctly in the first go, beta. Dhyan denge, Sneha, all of you are nice. Dhyan denge, beta, please try to understand. Remember, beta ji, look at the age of presentation. 40 plus years. How can it be Gilbert syndrome? Try to understand, my dear friend. Most likely answer of this question is obstructive jaundice secondary to the gallbladder stones, my dear friends. Yes, now all of you have come up with the right answer. Yes, this is C, my dear friends. This is C. Yes, all of you are correct, beta. C is the correct answer to this question. ध्यान देंगे इसको बेटा. Obstructive jaundice. I told you a rule, my dear friends. For obstructive jaundice, हम लोगों को याद रखना पड़ेगा. Conjugated bilirubin. Look here. Conjugated bilirubin, my dear friends, will be more than or equal to 50% of total bilirubin. Conjugated bilirubin आधा या उससे ज्यादा होगा टोटल बिलिरुबिन का. टोटल बिलिरुबिन यहां पर था 5.6. Out of that, conjugated, my dear friend, was 3.6, unconjugated 2. So this is going towards conjugated bilirubin. Alkaline phosphatase, my dear friends, is also raised over here. Alkaline phosphatase 427. ध्यान देंगे. It is raised. It is going towards obstructive jaundice more. Also try to understand important point, beta. GGT. Do not forget. And LFT is not complete without GGT. LFT has to be with 4 enzymes. ALP, ALT, AST and GGT, and here GGT also, my dear friend, is raised. GGT also is raised. If this is two raised together, my dear friends, it has to be this one, my dear friends. ध्यान देंगे बेटा, this is going towards obstructive jaundice. One more hint for gallbladder stones or obstructive jaundice. ध्यान दीजिए, one more time बेटा जी, because the age 42 year, 42, male or female, female. There was something called as rule of F. All of you know, female patients at the age of 40, fertile and obese. Please try to understand. ध्यान देंगे. All of this is also pointing towards gallbladder stones. Yes, and you are right. ALP and GGT raised together, my dear friends. ध्यान देंगे इस चीज को. इंपॉर्टेंट पॉइंट टू बी फॉलोड ओवर हियर बेटा. Conjugated bilirubin rising, ALP and GGT both are rising together. Isolated ALP more tuned towards bone disorders, आइसोलेटेड जीजीटी मोर ट्यून टुवर्ड्स अल्कोहलिक इंड्यूस्ड लिवर इंजुरी। ध्यान देंगे बट इस चीज को, as both of them are rising together, most tuned towards obstructive jaundice, right? ध्यान देंगे। To confirm this, they had also done bile salts positive in the urine, urinary bile salts। ये देखिए, ये वाला भी एक हिंट है, try to focus here, do not miss this। urinary bile salts is positive, my dear friends। why urinary bile salts are positive? I told you, obstruction due to gallbladder stones. There is some gallbladder stone obstructing the normal hepatobiliary tree. There is a traffic jam caused at the hepatobiliary tree, so the outflows is getting obstructed. All the contents that are supposed to come from the liver are not reaching to the second part of the duodenum because there is a stone blocking this route. So what will happen? Now these contents will be regurgitated in the blood। ध्यान दीजिए, normal route of bile outflow is towards the second part of the duodenum। Bile will be bringing bile acids as well as bile salts, so they should be normally coming out into the intestine। Normally the job of the bile salt is to cause emulsification of fats in the intestine। That is the normal job of bile salts, so they should be coming into the intestine, my dear friends। Now there is a traffic jam, there is a stone raising a red color signal, so it can't go through that route, so all the bile salts now will not come into the GI tract, they will be pouring or regurgitated into the bloodstream। Agar something is coming in the blood, it will be also reaching the kidney, and in the urine that will be coming out, and this urinary bile salt will become positive, my dear friends। ध्यान देंगे इस चीज को, urinary bile salt positive, this can be detected by a special test, my dear friends, called as Hayes sulfur test। This can be detected by Hayes sulfur test। ध्यान देंगे, important point to be noted, try to focus here। This is detected by Hayes sulfur test। This Hayes sulfur test basically is a special test for the urinary bile salts becoming positive, that you can also see over in the MCQs also it has been mentioned, Hayes sulfur test। USG whole abdomen report was not available, if there was an ultrasonography available you could have also seen the stone as well as you can talk about the size of the diameter, all those things can be visible, but in absence of an USG report, my dear friends, we have to mainly depend on the blood test, and these three must be thought of। ध्यान देंगे, please try to understand बेटा। It is not hemolytic jaundice, because in hemolytic jaundice cases your unconjugated bilirubin will be more than conjugated। Acute viral hepatitis, my dear friends, there will be too much rise of the ALT AST। ध्यान देंगे, ALT also it is raised but it is not too much, it is not too much। AST also it is raised, again it is not too much, my dear friends। ध्यान देंगे, try to focus here, ALT, AST, both are raised but these are not too much, so it can't go for acute viral hepatitis। And Gilbert syndrome, you guys have answered that, look at the age group, look at the age group, try to focus here। In Gilbert syndrome and all, we don't get this Hayes sulfur test positive and those things are there। GGT is also not much raised in case of this Gilbert syndrome। So the answer to this question, it is the obstructive jaundice, mostly secondary to gallbladder stones। Yes, moving to the next question बेटा, ध्यान देंगे इस चीज को, try to focus here। Little bit big question, but don't panic। Whenever you see this 1 kilometer long, 2 kilometer long question, please try to understand, more the literature, more will be hint। जितना ज़्यादा वो लोग लिखेंगे उतना आसान होगा हमारे लिए MCQ सॉल्व करना। Try to understand this, don't panic बेटा। First try to look at this। ध्यान देंगे, don't panic। Here the question is, which of the following liver enzyme is least likely to be elevated in his LFT? So first we need to arrive at the diagnosis and then we have to mark the answer correctly। ध्यान देंगे बेटा, इसको थोड़ा सा पढ़िए, no need to rush, time is there, nobody is running behind you, try to look for here। ध्यान देंगे, important question might be asked, try to look here। ध्यान दीजिए बेटा। Yes, yes, yes. Now the answers are coming, but all the options are there in the chat. All of you are answering A, B, C, D, A, B, C, D. No, but I want one answer. I want the correct answer, my dear friends. I want the correct answer. So let me help you out over here. Let me help you out over here. ध्यान दीजिए. No need to rush. We have one 45-year-old male presented to ED. ED stands for emergency department with sudden onset chest pain, mostly radiating to the left shoulder. चिल्ला चिल्ला कर बोल रहा है, pain radiating to the left shoulder, my dear friends. Okay, chest pain radiating to the left shoulder. Obviously, the first thing that you should think that might be a patient of MI or myocardial infarction. He was given some sorbitrate tablet, isosorbide dinitrate, and performs also a 12 lead ECG with the long lead 2. ये सब long lead 2 बस आपको confuse करने के लिए दिया गया है. Try to understand. ECG करेंगे. And also showed remarkable changes in the 2-3 AVF. All of you know 2-3 AVF. If you are seeing changes in the ECG leads, then it will go for inferior wall MI. What is the diagnosis of this? First try to understand the diagnosis of this patient, beta ji. 2-3 AVF, 2-3 AVF, 2-3 AVF. Yes. 2-3 AVF, my dear friends, will go for inferior wall MI. At least remember this diagnostics. Inferior wall MI. Most dangerous one. Left ventricle. Please try to understand. Inferior wall MI, my dear friends. Inferior wall MI. First remember this diagnosis. इस क्वेश्चन से 2-3 क्वेश्चन निकल के आ सकते हैं. Try to focus here. Inferior wall MI. And obviously, inferior wall MI was made and the patient was admitted to the coronary care unit, the CCU. As a protocol of that particular hospital, whenever routine investigations are also sent, LFT was also sent, and which of the following liver enzyme is least likely. So basically they are asking in a patient of MI, which is the liver enzyme that is never ever elevated. Answer to this question without any doubt, alkaline phosphatase. Alkaline phosphatase. Yes, Siddharth, you are right, beta, that it is written in the question itself, inferior wall MI. So, MI patient में which of the liver enzyme is not elevated? Answer to be marked as alkaline phosphatase, beta. This is ALP. Please remember, AST will be raised because this is more of heart specific. ALT also to some extent will be raised in patients of MI. Please try to understand. Mainly this is liver specific. Too, in some patients this can be also there. And also remember, GGT, my dear friends, can also be raised in patients of the MI. Gamma glutamyl transferase, although we think it is the most specific one for the alcoholic induced liver injury, whenever we have heavy alcohol intake over few days, then we have this GGT also getting raised. So, but GGT can be also raised, my dear friends, in patients of MI, also in patients of COPD. Yes, chronic obstructive pulmonary disease, COPD can also rise this GGT. So, these three technically can rise. AST rise will be the most important over here. But this alkaline phosphatase, my dear friends, never elevated in MI patient. Yes, Kanupriya, you are exactly right. You have hit the nail. In our discussion at MIST, we have written down this line. Enzyme never elevated in MI patient. Answer is alkaline phosphatase. Yes. In myocardial infarction, alkaline phosphatase is not elevated. Same story has been asked in the form of a clinical one in this exam. So please try to understand. ध्यान देंगे इसको. GGT also rises. Beta, please try to understand. Gamma glutamyl transferase is actually a non-specific enzyme. Beta, इसको ध्यान देंगे. This is a non-specific enzyme. It is not only present in our liver, it is also present in multiple tissues. Beta, GGT का बहुत सारा isoenzymes है. Roughly around 27 to 29 isoenzymes of GGT has been identified till date. Beta, ये जीजीटी बॉडी में बहुत जगह पर है, लंग्स में भी है, हार्ट में भी है, but usually we try to stick to this basic level that GGT is mostly seen in the liver and it is mainly associated with alcoholic liver disease. But please remember, this is a non-specific enzyme and it is a part seen in multiple sites. In MI patient rise होता है, COPD patient में भी GGT will be rising. But most important, अगर isolated GGT rise is asked in your exam, then it is mostly tuned towards alcohol-induced liver injury. That too also when the alcohol consumption has been done for few months, heavy alcohol intake. Try to understand, ध्यान देंगे इस चीज को. Non-specific enzyme. Try to focus here बेटा. Sana, I hope you are able to understand this. GGT बेटा केवल सिर्फ लिवर में ही नहीं पाए जाते हैं बेटा. It is also seen in multiple tissues outside the liver as well. Because in enzymes topic we study a topic called as isoenzyme. Isoenzyme का मतलब होता है multiple isoform of the same enzyme but found in different tissues. Try to understand. GGT has got multiple isoenzymes. Hope this is important and let us try to move to the next question. ध्यान देंगे इस चीज को बेटा. Try to look at this. Yes, focusing on the next question. Focus over here. Yes, something related to MBBS student. Okay, dedicated to you guys all. Read the question carefully. Read the question carefully, read the question carefully, read the question carefully. What they have asked. Yes, this is an easy question comparatively. Try to focus over here. This is an important question, beta. Try to focus over here. Right. Yes, Hariharan. Yes, all of you are answering, beta. Rafikul. Beta, I need you to read the question one more time. Till now, the correct answer has not come. We need to read the question carefully, beta. ध्यान देंगे इस चीज को. Anish, you have answered the question correctly. Yes, beta. Anish, Yukta. Yes, Yukta also have answered the question correctly. Let me help you out. Let me help you out, beta, because so many others wrong answers are also coming. Let me pitch in over here and let me also help you over here. 23-year-old, final year of MBBS, joins gym, starts doing heavy workout as he wishes to achieve his target weight in the 3 months. Under such condition, compared to the resting state, his vigorously contracting muscle will show what? Now all of you are answering it correctly. Okay. Yes, vigorously contracting muscle. When you are performing heavy exercise, you are keeping on lifting heavy weights. Keeping on lifting heavy weights, my dear friends. We all know that when you are exerting your muscles too much, ultimately the type of reactions that you will move to, it will be anaerobic glycolysis. And during the anaerobic glycolysis, my dear friends, what will happen to pyruvate? Pyruvate will be mainly converted to lactate. What is the enzyme over here, beta? There is LDH. This is the enzyme, lactate dehydrogenase. Pyruvate will be converted to lactate, my dear friends. Right, beta ji? Pyruvate will be converted to lactate over here. ध्यान देंगे इस चीज को. Try to focus here, beta ji. Important point. Try to focus. And in this reaction, try to remember, beta ji. Name of the enzyme is lactate dehydrogenase. So from lactate side, if you want to come back to this pyruvate side, beta, there is production of NADH plus H plus. So in this reaction, NAD from the lactate site will take out 2 hydrogen. It will release NADH plus H plus and there will be production of the pyruvate. But if you talk about pyruvate production more by glycolysis, that is going to form lactate. NADH plus H plus will be converted to NAD, right? ध्यान देंगे. So read the question. The second option also, beta. Although the answer to this question, my dear friend, is A, that we can easily understand. Increased conversion of pyruvate to lactate. But we should also at least focus on the second option. They have asked increased NADH to NAD plus ratio. if they would have written decreased, then that also would have been a correct answer. ध्यान देंगे, this ratio is also important over here बेटा, NADH to NAD plus ratio. What is the ratio बेटा? अगर आप पायरुवेट को ज्यादा लैक्टेट में कन्वर्ट करोगे, which thing you will be utilizing? You will be utilizing NADH plus H plus. That will be converted to NAD. So whenever pyruvate is getting converted towards lactate, it is going towards lactate, then this guy will be getting used because it has to get converted to this. So this guy's concentration will be low and NAD concentration will be gradually rising, isn't it? अगर आप लेफ्ट से राइट में आते हैं माय डियर फ्रेंड्स, इफ यू आर कमिंग फ्रॉम लेफ्ट टू राइट, if you are coming from left to right my dear friends, then it is going from NADH to NAD, and this NADH to NAD my dear friends, this compound will be becoming low and NAD will be rising. So what will happen to this ratio? NADH to NAD ratio is going to get decreased. Here they have mentioned increase, that's why this is a wrong answer in this question. So try to rule out this option as well beta. ध्यान देंगे इस चीज को, try to focus over here. Just a moment beta, just a moment, try to focus here, try to focus over here. ध्यान देंगे इस चीज को, try to remember this, try to focus over here. Welcome back. So hope you are able to understand this point beta ji, that the NAD is going to rise up, NADH plus H plus is going to decrease up, so the ratio is going to get decreased. So ध्यान देंगे इस चीज को बेटा. Try to move to the next question, try to move to the next question. Hope you guys are able to follow this. Yes, coming to the next question बेटा, ध्यान देंगे इस चीज को. Important point, look here. This is quite an interesting and easy question, easy going question, but it is also an important question in your upcoming exam beta. ध्यान देंगे, try to look here. Yes, 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 yes. All of you are right. All of you are right, my dear friends. Yes. Waiting for the answers. Yes, yes, yes. So 25-year-old male wakes up at 7:30 a.m. sits down at the breakfast table and चिल्लाकर बोलता है that he is starving. Give him food. Give me food. But he had finished dinner at 7:15 p.m. He had finished dinner at the 7:15 p.m. And which of the following pathway will be still ongoing? Which of the following, if a biopsy is taken, which of the following pathway will be still ongoing beta ji? Answer to be marked as the glycogenolysis, because glycogenolysis is up to 18 hours. This is up to 18 hours. ध्यान देंगे इस चीज को बेटा, up to 18 hours. Try to remember this. Yes, so all of you have answered this question correctly, beta. All of you up to 18 hours there is glycogenolysis. 7:30 a.m. if you start counting, 7:30 a.m. to 7:15 p.m. beta. Please try to look here. ध्यान देंगे इस चीज को. Try to understand over here. 7:15 p.m. 7:15 p.m. my dear friends. That it is 7:30 a.m. It has not crossed even 18 hours. So ध्यान देंगे इस चीज को बेटा. Up to 18 hours, up to 18 hours it is glycogenolysis. हमको ये चीज भी याद रखना पड़ेगा. More than 18 hours to 72 hour. This is by gluconeogenesis. This also is important beta. More than 18 hours to 72 hours it is gluconeogenesis. Important. So this is an important question. Up to 18 hours it is glycogenolysis that we have to remember over here beta. ध्यान देंगे. Try to focus. Yes, so gluconeogenesis. Please also remember this question beta. Yes. Ketone body synthesis, my dear friends, will be basically seen after few more days after the fatty acid breakdown basically starts. So fatty acid breakdown and these things, those will be seen after few more days. Right. Moving to the next question beta. ध्यान देंगे. Yes, look here. Try to focus here beta ji. Yes, next question. Next question. Waiting for your answers. I hope all of you, yes, 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 all of you are coming out with the right answers beta. इसमें कोई doubt ही नहीं है. And I hope all of you who are joining this live session, all of you have answered this question correctly without any doubt that it has to be this injection of vitamin B1, option number C. C, 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 C. Yes, C, my dear friends. So alcoholic patients, generalized weakness, lethargy. Obviously B1 is also associated with energy production, so that will be going down. And please try to understand, he is telling that stories that are not entirely true as per the accompanying wife. ध्यान देंगे बेटा, this is a case of Wernicke's encephalopathy because there is global confusion, nystagmus and ataxia, and also there is confabulation beta. Not entirely true. This portion, my dear friend, is confabulation. Yes, this entity, it is also called as beta confabulation. Hope you are able to follow this. This is confabulation beta, and due to this alcohol induced vitamin B1 deficiency, confabulation, this is diagnosis of Wernicke's-Korsakoff syndrome. Wernicke's-Korsakoff syndrome beta, and in Wernicke's-Korsakoff syndrome in severe cases you have no other options left apart from giving injection of the vitamin B1. So classical triad of the Goa, remember Goa, we have discussed about Goa, global confusion, ophthalmoplegia seen as nystagmus, and ataxia, that is the gait disorder. Goa, yes, chronic alcoholism, my dear friends, right? Hope there is no confusion. This is a good question. I hope this sort of question comes and all of you can answer this question correctly without any doubt. May every one of us pass, my dear friend. May every one of you pass. Yes. Moving further. Next question. Yes. Next question. Sorry my dear friends, there was some lag in the internet. I hope the internet connectivity has been resolved and now you can all see me and hear me without any glitch. Yes, ध्यान देंगे बेटा, please try to focus here. Right, let me help you out with the question. ध्यान देंगे इस चीज को, please try to focus. 73 year, ध्यान देंगे बेटा, 73-year-old woman, 73-year-old woman comes to the physician because of 6 months history of diffuse weakness and pins and needle sensation. My dear friends, pins and needle sensation, basically it goes toward tingling sensation. My dear friends, yes, tingling sensation, tingling sensation. ध्यान देंगे, in her bilateral arms and legs, in our extremities, neurologic examination shows weakness of the extensor and the flexor muscle of the lower extremities, and sensation to the vibration and position in also decreased in the all 4 extremities. Try to understand my dear friends, don't jump into conclusion. Many of you have answered this correctly, but many of you have also gone for vitamin C. No, please read the question carefully. ध्यान देंगे बेटा, no need to write, no need to panic. Try to look here closely beta. What are the important point? Try to understand. This sort of question can come. There is weakness of the extensor and flexor muscles of the lower extremities. Yes, now all of you are coming out with the right answer beta. Now all of you are coming out with the right answer. The answer to this question, my dear friends, is this vitamin B12. Yes, vitamin B12. ध्यान देंगे बेटा. Try to focus. What is the take home message? How do we differentiate? Please remember, sensation to the vibration and position is also decreased in all 4 extremities. Important point beta, vibration and position sense is being decreased in all 4 extremities. This disorder, my dear friends, it is called as SCD. What is the diagnosis? What is the diagnosis, my dear friend? SCD, that is subacute combined degeneration. ध्यान देंगे बेटा, this is subacute combined degeneration beta. ध्यान देंगे बेटा, this is not related to those B6 beta. This is SCD, subacute combined degeneration. Important point, इसको ध्यान देंगे बेटा. Please try to understand. This is bit a tricky question because they had mentioned about pins and needles. Try to look here. Whenever they are mentioning about pins and needles or tingling, try to remember, my dear friends, this is mainly seen with B1 deficiency as well as B12 deficiency as well as B6 ka excess. Try to look here. Yes, Himanshu, yes, medicos, you are right. Yes, Singham, methyl cobalamin. Please try to understand. The answer to this question was B12 deficiency, but also do study and understand this bit of pins and needles or tingling sensation that we see. That will be mainly with B1 deficiency, B12 deficiency and the B6 excess my dear friend. But here please try to understand the hallmark finding. There we have to decide this as B12 my dear friends. ध्यान देंगे B12 because in B12 deficiency we have a disorder called as subacute combined degeneration. Subacute combined degeneration beta. Please try to understand. In B12 deficiency, B12 we all know it is very important for the production of the SAM. ध्यान देंगे B12 is important for the production of the SAM because if you remember the pathway beta that we have discussed, that in B12 deficiency, homocysteine can't be converted to methionine. Homocysteine to methionine conversion, important point to be noted, it is dependent on the B12 as well. And if B12 is deficient, homocysteine cannot be converted to methionine. Methionines active form is called as our SAM uncle. So SAM production will be decreased. In a patient of B12 deficiency, my dear friends, SAM production is going to get decreased. Try to understand the link over here. ध्यान देंगे, try to learn it. SAM production will be decreased. And if SAM is getting decreased beta, there will be decrease in methylation. There will be decreased in methylation. ध्यान देंगे बेटा, there will be decreased in the methylation. And as there is decrease in the methylation beta, please remember there will be failure of methylation of one arginine in the myelin basic protein. ध्यान देंगे बेटे इस चीज को. Please remember, in this one there is failure of methylation of one arginine in the myelin basin protein, and this myelin that is needing this methyl group, it is actually coming from our SAM uncle. But for the SAM regeneration, try to understand, we require vitamin B12. So अगर किसी पेशेंट में B12 का deficiency है, ultimately there will be a problem in the myelin maturation, my dear friends. And as there is problem of methylation of myelin, these problems will be basically related as or seen as neurological defects, due to which our loss of position and vibration sense will be decreased in all four limbs. And in this disorder, where there is failure of methylation of the myelin, this disorder, my dear friend, it is called as this subacute combined degeneration. And the word we use as combined degeneration because in this disorder, please remember, both motor plus sensory tracts are damaged. Both motor and sensory tracts are damaged. ध्यान देंगे, both motor and sensory tracts are damaged, my dear. That's why it is called as combined degeneration of both motor as well as sensory. That's why all four limbs are affected. And in this subacute combined degeneration, my dear friends, we should also remember, as there is loss of position and the vibration sense is given. Beta, yes beta, this is a googly question. Yes, right word you have used. This is a googly question, पूरा googly डाला हुआ इधर. ध्यान देंगे, subacute combined degeneration बेटा, try to understand बेटा जी, ध्यान देंगे इस चीज को. इसमें हमारे पास दो साइंस पॉजिटिव होते हैं बेटा. प्लीज डू नॉट फॉरगेट दिस टू साइंस जो एग्जाम में एमसीक्यू में पंच करके दे सकते हैं टू कंफ्यूज यू गाइस. रिमेंबर, वी हैव Babinski साइंस पॉजिटिव. Babinski sign positive over here. Babinski sign for positive, and the second sign we will remember, it is the Romberg sign. It is the Romberg sign also positive in these patients. Yes, please do remember these two things beta. Babinski sign, whenever you are taking a sharp object and try to scratch the outer aspects or the lateral side of the feet, then there will be fanning of the great toe like this. Babinski sign. Try to understand, my dear friend. And in Romberg sign, my dear friends, if I ask the patient to stand and close his eyes like this, there will be swaying with eyes closed. The patient will be swaying with eyes closed. अगर आप patient को खड़ा कर दिया और बोला कि eyes को close करके रखो, he can't be static. He will be swaying with eyes closed. This sort of feature is called as Romberg sign. Romberg sign and Babinski sign both are also positive in subacute combined degeneration, my dear friends. ध्यान देंगे इस चीज को बेटा. इंपॉर्टेंट पॉइंट टू बी नोटेड बेटा. Babinski sign and Romberg sign, subacute combined degeneration, both sensory and motor tracts are damaged. That's why we are using the word as combined. And in this one, the main problem is the decreased reproduction of the SAM. I'm using the word reproduction or regeneration of the SAM, due to which there is a failure in methylation of one arginine in the myelin basic protein. केवल सिर्फ एक आर्जिनिन के साथ मिथाइल ग्रुप ना जुड़ने के कारण one arginine is not getting a methyl group. Due to that, there is this dangerous condition known as subacute combined degeneration. Yes, bouncer. ये तो bouncer है बेटा. googly question था बेटा. ध्यान देंगे इस चीज को. Please try to understand. Tingling sensation can be seen with B1, B12 का deficiency, but B6 का excess. वो जो आप लोग मैसेज में डाल रहे थे in the chat section, premenstrual symptom. A female patient taking exogenous supplementation of B6, B6 excess can also lead to those tingling sensation. It can also be seen in patients of beriberi or in Wernicke-Korsakoff syndrome. as well as it can be seen in subacute combined degeneration. इस केस में main key point that is this decrease in all four extremity. What thing is getting decreased? Vibration and the position sense. Why both of them? Because we have involvement of both motor and sensory tract. Yes, my dear friends. So please remember, इसको ध्यान देंगे बेटा. Please try to focus on this. Hope this is clear to all of you. Moving to the next question बेटा. इसमें आंसर करना है B12. B12. Whose deficiency? बेटा क्वेश्चन में देखो एक वर्ड है B6 का deficiency. Don't jump into the question. Please read the question. Deficiency बोला गया था, tingling sensation बोला गया था. You can directly rule out this B6, isn't it? B6 का excess will cause this peripheral sensory neuropathy, which will present with tingling sensation. Confusion इस क्वेश्चन में दो जगह पर था, B12 के B1. B12 के B1. Better answer is B12 because B12 के साथ ही we have neurological features more. Hope this you have answered correctly बेटा. ध्यान देंगे इस चीज को. Moving to the next question. जल्दी से मूविंग टू द नेक्स्ट क्वेश्चन बेटा. राइट, इंपॉर्टेंट पॉइंट, इसको ध्यान देंगे. ट्राई टू लुक हियर. यस, प्लीज रीड. Yes, Medvision, please try to understand. You have asked me a question in the chat section, beta. The isoniazid, yes, isoniazid is also known to cause B6 deficiency. Yes, now moving to this question, answers have already been started to come. Yes, my dear friends, all of you have answered this question correctly. Bizarre disorder, क्या बात है बेटा? All of you have answered this question as the A, that is A, HGPRTS deficiency. Diagnosis is Lesch-Nyhan syndrome. क्या बात है, क्या बात है. Hats off to you, all of you, my dear friends. You are going to pass this FMGE of 30th July without any doubt. I have immense belief in all of you, my dear friends. Yes, इसको देख लेते हैं एक बार फिर से. 7 साल का बच्चा, 7-year-old child, aggressive behavior, poor concentration to studies, present complaints of joint pain in the lower limb and difficulty in playing football. This was the history. Mother also adds that she has been receiving complaints from the school that her son is frequently getting involved in fights and beating other fellow mates without any valid reason. Remember the joke that I have cracked in the class. If you have gone near these children, instead of getting a kiss on your cheek, you will be getting a slap on your cheek, my dear friends. ध्यान देंगे इस चीज को. That was the joke. But please remember the main important finding that the son mutilates his fingers by biting. Son, more commonly also in male patients. This sort of behavior is called as self-mutilating behavior. Self-mutilation, my dear friends. ध्यान देंगे. हॉस्टाइल नेचर बेटा, दिस इज हॉस्टाइल नेचर, सेल्फ म्यूटिलेशन, एंड दिस बिजार डिसऑर्डर इज मेनली सीन विथ HGPRTS डेफिशिएंसी. प्लीज ट्राई टू अंडरस्टैंड. ध्यान दीजिए. ट्राई टू लुक हियर. दिस इज 2 इमेज बेस्ड क्वेश्चन दैट माइट बी आस्क्ड इन योर एग्जाम लाइक दिस बेटा, जो हमारे वर्कबुक में भी दिए गए हैं. ध्यान देंगे. This is chewing of the fingers, and due to chewing the nail beds are getting exposed. There is too much of bleeding. You guys can see here that the blood is tinged one. Whenever they are damaging like this, there is a pain, but they can't control the urge to destroy themselves. Peculiar disorder. दर्द होता है जब ये लोग नाक उंगली चबा रहे हैं. There is दर्द, there is pain, but please try to understand they can't stop destroying themselves. Also remember in severe cases, my dear friends, also remember in severe cases there will be दिस ईटिंग अप ऑफ द लोअर लिप. बेटा ध्यान दीजिए बेटा, पूरा का पूरा लोअर लिप यहां पर गायब हो गया है. कहां चला गया? ये बच्चे का पेट में चला गया, माय डियर फ्रेंड्स. द चाइल्ड हैज ईटन हिज कंप्लीट लोअर लिप, एंड दिस सॉर्ट ऑफ हॉस्टाइल बिहेवियर, ऑल्सो टेंडेंसी टू डिस्ट्रॉय हिमसेल्फ, इज सीन इन दिस पेक्यूलियर डिसऑर्डर. ध्यान देंगे. प्लीज ट्राई टू अंडरस्टैंड. ध्यान देंगे. Important point, please try to look here. I am giving you one mnemonic for your exam beta. Please remember, for this we have self confident men get heavy सक्सेस. ध्यान देंगे बेटा, सेल्फ कॉन्फिडेंट मेन गेट हेवी सक्सेस. ऑल्सो ध्यान देंगे बेटा, प्लीज रिमेंबर दिस निमोनिक टू अंडरस्टैंड. मोस्ट इंपॉर्टेंट फीचर हम लोग लिखेंगे सेल्फ म्यूटिलेशन. मोस्ट इंपॉर्टेंट इज द सेल्फ म्यूटिलेशन. ट्राई टू रिमेंबर. कॉन्फिडेंट से टू इंपॉर्टेंट पॉइंट्स, वी कैन हैव कोरियोएथिटोसिस, we can have chorioathetosis plus also dystonia. Chorioathetosis and dystonia, my dear friends. Men से ध्यान देंगे, this is mainly seen in male child. Male child. E से extremely hostile. E से extremely hostile. एंड एन से हम लोग याद रखेंगे बेटा किडनी स्टोन्स, दैट इज नेफ्रोलिथियासिस. नेफ्रोलिथियासिस, ध्यान देंगे, नेफ्रोलिथियासिस इंपॉर्टेंट पॉइंट, ध्यान दीजिए बेटा. गेट से हम लोग याद रखेंगे दैट इज हाउ हाई चांस ऑफ गाउट फॉर्मेशन. हाई चांस ऑफ गाउट फॉर्मेशन सेकेंडरी टू हाइपर यूरिसीमिया. सेकेंडरी टू हाइपर यूरिसीमिया. Hyperuricemia initially will be seen, which later on will move to gout, and this is also a disorder where there is early age kidney stones. Early age kidney stones, my dear friends. And success से हम लोग याद रखेंगे spastic child और spasticity. So these are the most important feature from this. Yes, ध्यान देंगे बेटा. चेरी रेड स्पॉट इन मैक्यूला इज नॉट रिलेटेड ओवर हियर. यू आर मेकिंग ए मिस्टेक ओवर देयर. दैट इज एन के साथ था निमैन-पिक डिजीज. Cherry tree never grow tall in sands was the mnemonic for those cherry red spot in macula. C से था CRAO, central retinal artery occlusion, not the venous, because central retinal vein occlusion will give you tomato splash appearance. That is a different question. CRAO, CRAO, CRAO will go for cherry red spot in macula. Then tree से हम लोग याद रखेंगे trauma, 4 lipid storage disorder, cherry tree grow, नेवर ग्रो. एन से निमैन-पिक डिजीज, ग्रो से गॉचर्स डिजीज, टॉल से टे-सैक्स एंड सैंड से सैंडॉप्स. सैंड से सैंडॉप्स, दैट इज चेरी रेड स्पॉट इन मैक्यूला. बेटा ध्यान देंगे फहीम, आई हैव जस्ट आंसर्ड योर दिस वन. ध्यान देंगे चेरी रेड स्पॉट इन मैक्यूला. ध्यान देंगे इंपॉर्टेंट पॉइंट, प्लीज रिमेंबर चेरी रेड स्पॉट इन मैक्यूला. Yes, sphingomyelinase deficiency, we have Niemann-Pick disease that may present with cherry red spot. But here these features are different. These are mainly for the Lesch-Nyhan syndrome beta. ध्यान देंगे, try to focus on this. ध्यान देंगे, important point, please remember. Adenosine deaminase deficiency. The answer to this question is AGPRT. But please remember, adenosine deaminase deficiency leads to a disorder that is called as SCID. SCID beta. This disorder is called as SCID. Severe combined immunodeficiency. Severe combined immunodeficiency. ध्यान देंगे, important. And acid maltase deficiency leads to Pompey's disease. That is a type of glycogen storage disorder. So don't miss these two as well, beta. That has been already asked in your exam. Please try to understand. ADA deficiency से होता है बेटा SCID. Don't get confused with SCD. We have just now discussed SCD means subacute combined degeneration. That is due to B12 deficiency, isn't it? But ADA deficiency leads to SCID, that is severe combined immunodeficiency, in which T lymphocyte, B lymphocyte and natural killer cells are all lost together, for which gene therapy is the treatment. For which gene therapy is the treatment. Yes beta, yes Fahim, ध्यान देंगे. ADA deficiency, SCID, acid maltase deficiency, Pompey's disease. Pompey's disease. तो इसको याद करेंगे. मूविंग टू द नेक्स्ट क्वेश्चन, ट्राई टू फोकस हियर. ध्यान देंगे इस चीज को बेटा. यस, प्लीज हैव ए लुक. ध्यान देंगे इस चीज को। बेटा दिस इज अ टफ क्वेश्चन, this is a tough question that we are discussing over here, but we need to understand this because similar type of question has been asked in your FMGE exam recently, my dear friends. ध्यान देंगे इस चीज को। Try to look here. ये tough question है। Let me come and pitch in forward. Try to look here बेटा जी। सबसे पहले we have got 27-year-old male presenting to the OPD. There is reddish brown staining of the teeth and there is occasional blister formation. There is occasional blister formation when exposed to sunlight for a long time. Medicine HOD confuse हो गया, referred the case to a dermatology, वो further confuse हो गया and referred the case to us, biochemistry. As for a second opinion, lab reports revealed raised coproporphyrin 1 levels and explains the risk of photosensitivity and diagnose the case to be a rare form of porphyria. बेटा ये लोग इधर ऑलरेडी आपको बोले हुए हैं that this is a rare form of porphyria. Yes my dear friends, Kanupriya and Anudashrini, yes my dear friend, also please remember क्या बात है, this my dear friend is called as the famous vampire's disease. Yes, this is a vampire's disease question, my dear friends. And in vampire's disease, please do remember, as vampires, they suck on blood. Due to their sucking of blood, there will be reddish staining of the teeth. Please try to understand, my dear friends, why it is called as vampire's disease. Because there is reddish brown staining of the teeth. Reddish brown staining. Whenever somebody is sucking on blood, the teeth will be getting drenched in blood, इसलिए वो लाल लाल दिखेगा. Try to understand, reddish brown staining of teeth. And there is also, my dear friends, occasional blisters formation whenever they are exposed to sunlight. So this diagnosis, my dear friend, is vampire's disease. Here the diagnosis is vampires. This is vampire's disease question. Yes, you are right, beta Kanupriya. There is also higher chance of hypertrichosis, more body hair growth, but in this particular patient, they have not mentioned about that. And in vampire's disease, my dear friend, this is due to deficiency of the uroporphyrinogen. This is uroporphyrinogen 3 synthase. This is due to the deficiency of the uroporphyrinogen 3 synthase. Yes, beta Anudashrini, that is also called as erythrodontia. Yes, she has correctly pointed out, reddish brown teeth का मतलब होता है erythrodontia. Erythrodontia, my dear friends. ध्यान देंगे इस चीज को. Recently asked question might be repeated one more time. ध्यान देंगे बेटा. Erythrodontia, ये क्वेश्चन आपके एग्जाम में ऑलरेडी आ चुका है. ध्यान देंगे बेटा. Erythrodontia, reddish brown staining of the teeth, and this is the enzyme that is deficient. Uroporphyrinogen 3 synthase. So what is the answer to this question, beta ji? Answer to this question is this B. ध्यान देंगे. This is the correct answer. This one is this uroporphyrinogen 3 synthase. ध्यान देंगे इस चीज को बेटा. This is the deficiency which is leading to vampire's disease, and if these vampire disease patients are going out in sunlight without proper precautions, without wearing gloves, then even 1 hour to 2 hours of exposure to the sunlight, they might come back with this blisters formation. ध्यान देंगे बेटा, these occasional blisters that you are seeing over here, this blister formation is mainly seen with vampires. That's why vampires, they do not go out in sunlight. They will always come out at night because they are scared of sunlight, my dear friend. इसीलिए ये peculiar bizarre disorder को हम लोग बोलते हैं vampires disease. ध्यान देंगे. Try to focus on this one, बेटा. Hope there is no problem over here. ध्यान देंगे इस चीज को. Try to focus here. Important point, photosensitivity. Yes, this is the photosensitive behavior. ध्यान देंगे बेटा. This is the photosensitivity. Yes, please try to focus here. This is the photosensitivity. ध्यान देंगे. Please try to focus. Remember this. Please try to focus over here. Right बेटा जी. Hope there is no confusion over here. ध्यान देंगे इस चीज को. Photosensitive behavior. Right. Let me write it over here. there is extreme photosensitivity. Extreme photosensitivity, right? Hope there is. Yes, Twilight movie as well as Underworld movies. Underworld, those three series. Kate Beckinsale, yes. Twilight movie, my dear friend, as well as in Underworld movie, we have to remember, yes, important. Bloody teeth is an important factor over, yes. Bloody teeth, erythrodontia, and this one. Let us try to look at the pathway beta. Why coproporphyrin 1 level was increased? I was talking about this particular disorder beta, congenital erythropoietic porphyria, that is CEP. That is due to deficiency of this uroporphyrinogen 3 synthase. ध्यान दीजिए, uroporphyrinogen 3 synthase. In this way, this pathway till heme production will be getting defective, and what will happen, as there is a block at this one, this hydroxymethylbilane will go for another pathway where it will go for this uroporphyrinogen 1, then from there corpoporphyrinogen 1, and from the coproporphyrinogen 1 it will be converted to coproporphyrin 1. Normal route tha wo wala site, please try to understand, normal route is this side to go for heme. In this case, as there is a traffic jam in this normal route due to this enzyme block, this pathway is getting bifurcated and ultimately getting converted to this coproporphyrin 1 level. That's why in vampires disease patients, we guys are seeing that there is a raised level of coproporphyrin 1. Coproporphyrin 1, my dear friends. ध्यान देंगे, important point. So that's why in this patient there was a raised level of coproporphyrin 1. Normally this coproporphyrin 1 should not be produced during heme synthesis. Normal route of heme synthesis is this zone. This is the normal route beta. अगर ये normal route नहीं होगा, then it is getting converted to this toxic compound, right? Important point. Yes, my dear friends, Roger, it is also the Blade series. Yes, Blade series movies. Yes, क्या बात है. So many movies on vampires. ध्यान देंगे, आगे बढ़ते हैं. Try to look here. Look at this question. ध्यान देंगे. Try to look here. Yes. Don't get shocked by looking at the literature. जितना ज़्यादा कहानी, उतना ज़्यादा hint. More the info, more will be the hint. Do not panic. Although it is looking like a very long question, but it is very easy. Very easy, beta. Don't panic. Please read the question carefully. ध्यान देंगे. Try to focus here. Hint is there in this question. Hint is there in this question, my dear friend. You need to find out the key words in an MCQ beta. Keywords in an MCQ. ध्यान देंगे इस चीज को बेटा. Keywords in an MCQ. Hint is there. Hint is there. Kishan, you are right, my dear friends. Kishan, you are right, my dear friends. इसको ध्यान देंगे बेटा. इसको ध्यान देंगे. No, 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 not Pompey's disease बेटा. This is not the Pompey's disease. Try to look here. ध्यान देंगे. Try to look here बेटा. एक hint है. एक hint है. We have one hint. Yes, yes, Dr. Alok, you are right. You are thinking in the correct line, beta. ध्यान देंगे. See, the most important point that we have discussed in the last half an hour. Please try to focus, beta. There is near total loss of T and B lymphocytes with the low immunoglobulin levels. Yes. ये बड़ा बड़ा लंबा जो क्वेश्चन होता है बेटा, उसमें से मेन फोकस हम लोगों का ये होना चाहिए दैट वी नीड टू फाइंड आउट द कीवर्ड. देखो, ट्राई टू लुक हियर, so much of info is given. I'm not bothered about that. I will not look at into that. I will look at this one that we have studied. Almost near total loss of T and B lymphocytes, low immunoglobulin levels. Immunity will be decreased in these patients. That's the reason, my dear friend. Please try to understand. The child had presented first with pneumonia, more prone for infection because T lymphocyte, B lymphocytes are gone, my dear friends. Combined deficiency, much more prone for infection. Pneumonia बच्चों में क्यों होता है? Decreased immunity, isn't it? As T and B lymphocytes are gone, that's why the child is mainly presenting with this one. ध्यान देंगे, pneumonia. There might be irritability. Also try to understand, there might be in some cases seizures. There might be in some cases seizures. That was not improving on treatment for more than a week at a small nursing home. Then they had also done, there was a feature of congestive cardiac failure, and there was also failure to thrive in this child. She also has been treated at the age of 6 months for pneumonia. Presentation it at 7 months, but just 1 month back, एक महीना पहले 7 month में भी present किया है, but just 1 month back she also had pneumonia. And please try to understand, there is a positive family history that the other sibling also died at the age of 6 months due to the severe pneumonia itself. And further workup revealed almost near to loss, though she received. Please try to understand over here that 2D echo might show the dilated cardiomyopathy itself, but that is not the point we should focus over here. We must focus over here T and B lymphocytes gone, my dear friends. ध्यान देंगे बेटा, ट्राई टू अंडरस्टैंड इंपॉर्टेंट पॉइंट. SCID, severe combined immunodeficiency patients are going to present with this. This is the hint that we need to understand. बहुत सारा कचरा भरा पड़ा है. From this we need to correct and we need to focus on the most important point for our diagnosis, my dear friends. Dilated cardiomyopathy is seen. It is an incidental finding. It might not be seen in all the patients of SCID. इस patient में वो है. ध्यान देंगे, chest X-ray confirmed features of pneumonia and 2D echo showed dilated cardiomyopathy, my dear friends. Though she received a dose of IV immunoglobulins over here with antibiotics and antiviral and antifungal. Why antiviral and antifungal? Secondary infections are more because if you have pneumonia, if you are immunocompromised patients, and in immunocompromised patients we also have antifungal or fungal infection more, for which the antifungal has been given. But although all these things has been tried, but unfortunately she dies within the few days of diagnosis. Life-threatening condition, severe combined immunodeficiency, diagnosis ADA deficiency beta. This we have discussed. This is leading to severe combined immunodeficiency. This sort of question can be asked beta. All of us know homogentisate oxidase deficiency leads to alkaptonuria. This is alkaptonuria. Acid maltase, just now we have discussed, it leads to Pompey's disease. Although Pompey's disease patients, they die early, but in Pompey's disease patients you are not going to see lung involvement or this pneumonia. Pompey's disease में cause of death is cardiopulmonary failure. That was the punch. That's why many of you were going for those Pompey's disease. I know why you are going for that, because you saw dilated cardiomyopathy and you also saw pneumonia. That's why you also thought it might be those acid maltase deficiency for Pompey's disease. But please try to understand beta, Pompey's disease cases mein we actually don't see pneumonia, and there is not much of loss of T and B lymphocytes ke uske liye IV immunoglobulins are given. Please try to understand, acid maltase is treated by enzyme replacement therapy. Yes, enzyme replacement therapy we have discussed by L-glucosidase alpha. IV immunoglobulins are not required in Pompey's disease. Please try to understand. So although we were seeing that there is a DCM or dilated cardiomyopathy and there is also involvement of our lungs, But this is not cardiopulmonary failure that we see in Pompe's disease, because there is no pneumonia beta in Pompe's disease, and there is also no need of IV immunoglobulins. ध्यान देंगे, this is how we need to differentiate. Here the main keyword was this green color highlighted line. And all of you know, this one just now we have heard about HMB synthase. This deficiency leads to acute intermittent porphyria. Acute intermittent porphyria. In acute intermittent porphyria, we all know the hallmark feature is the acute abdominal pain. That is acute abdominal pain, plus we have neuropsychiatric symptoms. Plus we have neuropsychiatric symptoms, right? So this history is not at all matching with this. So this is not in case of acute intermittent porphyria beta. Yes, Raja Ajendra, hope you have understood this. Hope you are able to learn how to rule out these closely related disorders. ध्यान देंगे, this is a punch question बेटा. ये कैरम बॉल था मेडिकोज, yes, ये कैरम बॉल था, समझ में नहीं आया, सही बेटा, बट अभी समझ में आएगा. If it is asked this sort of twist in the exam, now you guys can all answer this question correctly. That's why this punch is given, my dear friends. ध्यान देंगे. Important point. Moving to the next question. Moving to the next question. ये तो chocolate question है, my dear friends. This is very easy. This is gift वाला question है बेटा. This is gift वाला question. ध्यान देंगे इसको. This is gift. This is gift. ध्यान देंगे. Waiting for answers. Yes, Himanshu. Yes. Diagnosis over here. My dear friend. EDS. This is EDS. Ehlers-Danlos syndrome. ध्यान देंगे इस चीज को बेटा. Ehlers-Danlos syndrome. Now read the question carefully. Image से Ehlers-Danlos syndrome है. Try to look here. 15-year-old female presented to OPD with a 10-year history of chronic headache, which had recently become daily for the last 3 months, and wakes her up in the middle of the night. That's why she was forced to come now. Please try to understand, my dear friends. ध्यान देंगे. In patients of the Ehlers-Danlos syndrome, one of the important point that we have is chronic headache. ध्यान देंगे बेटा. Please try to understand. Chronic headache beta. ध्यान देंगे. In EDS, although we have not discussed this point during our discussion, but please remember, one of the hallmark finding in patients of Ehlers-Danlos syndrome is the chronic daily headache. This is called as chronic daily headache. ध्यान देंगे इस चीज को बेटा. Try to look here. Chronic daily headache, जिसको कभी कभार बुक में लोग लिखते हैं in the short form as CDH. Please remember, Ehlers-Danlos syndrome patients, my dear friends, it is chronic daily headache, one of the important presentation. ध्यान देंगे, for which she was not able to sleep properly at night. Past history also revealed musculoskeletal pain and syncope, fatigue and hypermobility of the joints. This was the main important point from where you have diagnosed the case as Ehlers-Danlos syndrome. Yes, good one. Mother also at the age of 10, she also had difficulty in chewing. That was the missing deciduous teeth. Please remember, teeth eruptions are a challenging thing in the Ehlers-Danlos syndrome patients. Please remember, in EDS, there is also problem with this one. Please remember, recently it has been diagnosed as a collagen vascular disorder. Which of the following collagen defect would most likely have caused this condition? Even if you do not go by this history, if you remove this image, most likely, my dear friends, read the question carefully. They have asked most likely, beta, most likely. I told you, most common collagen defect, most common collagen defect in Ehlers-Danlos syndrome. Answer is type 5 collagen, which is more common than type 3 collagen. Okay, yes. It was there in our workbook. We have marked it as a question. The type 5 collagen is the most common collagen defect in patients of Ehlers-Danlos syndrome. ध्यान देंगे इस चीज को बेटा. Please try to remember this. Most common collagen defect. This is type 5 collagen. Yes, in most severe one, there is a defect of type 3 collagen that presents with those frequent bruising with minor trauma. Here there is no bruising picture has been given beta. अगर most dangerous Ehlers-Danlos syndrome हुआ, we have two classifications, Berlin's classification and Villefranche classification. Under that, please try to understand, there are a lot of subtypes of Ehlers-Danlos syndrome. Ehlers-Danlos syndrome का जो most fatal form होता है, उसमें we have defect of type 3, but they have asked most likely due to type 5 because we have also studied collagen 5A1 gene mutation is the most common one. It is the most common. Collagen 5A1, collagen 5A1, ध्यान देंगे इस चीज को, इसको बेटा. Collagen 5A1 gene mutation is the most common gene mutation in this Ehlers-Danlos syndrome patient बेटा. So इसमें ध्यान रखेंगे, try to understand, please remember this. ध्यान देंगे बेटा. बोन होता है टाइप 1 में, टाइप 1 में आएगा तो we all know type 1 collagen vascular defect mainly leads to osteogenesis imperfecta, right? Type 3 leads to Ehlers-Danlos syndrome. Type 5 also leads to Ehlers-Danlos syndrome, but the most common over here is type 5. Type 4 collagen defect, this leads to Alport syndrome, my dear friends. Try to remember these 4 points beta. Osteogenesis imperfecta. अगर आपसे ये पूछ लिया कि most common collagen defect in Ehlers-Danlos syndrome, close your eyes, remember the letter E. I told you that E is the 5th alphabet, A B C D E. 5वां अल्फाबेट ई है, तो मोस्ट कॉमन का आंसर करके आना है ई, दैट इज टाइप 5 विदाउट एनी कंफ्यूजन माय डियर फ्रेंड, बिकॉज मोस्ट कॉमन जीन म्यूटेशन इज द कोलाजन 5A1 जीन म्यूटेशन. ध्यान देंगे इस चीज को बेटा, ट्राई टू रिमेंबर दिस. ध्यान देंगे, ट्राई टू फोकस हियर, कोलाजन 5A1. प्लीज डू नॉट गो बाय द हिस्ट्री, दिस इज जस्ट गिवन हियर टू फ्रेम द क्वेश्चन. Try to understand, if possible, apart from those features of Ehlers-Danlos syndrome that you already know, these patients, they also present with chronic daily headache or CDH. This I did not teach you during the class, but today I am focusing here, chronic daily headache. If you can stretch and remember, this is more important. History of the question is not more important. Here the MCQ that you have to focus is the most likely collagen defect. Try to take the crux out of these histories. Try to focus here. Try to focus, ध्यान देंगे, try to look here. Yes, medicos, epidermolysis bullosa, both defect of 6 and 7. Yes, you are right बेटा, ध्यान देंगे. Important point, try to focus on this. ध्यान देंगे इस चीज को बेटा. Try to look here quickly. Waiting for answers. Some history, some story they have given, but they have also given you the diagnosis along with this. बड़ा क्वेश्चन में से we need to focus on the main keywords. This is already telling you that what is the diagnosis. ऑलरेडी टेलिंग यू व्हाट इज द डायग्नोसिस माय डियर फ्रेंड्स। ध्यान देंगे इस चीज को बेटा, प्लीज रिमेंबर दिस इज अ टफ क्वेश्चन, लेट मी हेल्प यू आउट ओवर हियर। ध्यान देंगे, 2-year-old male with recent history of influenza like symptoms presented with neurological issues, elevated liver enzymes, elevated creatinine and hypoglycemia। ध्यान देंगे, and evidence of hyperammonemia, metabolic acidosis and convulsions are seen। Please remember these three things: hyperammonemia, metabolic acidosis and convulsions in the child। This is a classical triad that you get in patients of Reye's syndrome। ध्यान देंगे बेटा, please try to understand Reye's syndrome is mainly there is a classical triad of hyperammonemia, metabolic acidosis and convulsion in a child। They have asked what is the main pathogenic mechanism, pathogenesis during or behind this Reye's syndrome। Please try to understand, इसका बस आंसर हम लोग को थोड़ा सा याद रखना पड़ेगा। The correct answer of this question is this A, my dear friends। Please try to understand, this is the mitochondrial damage leading to escape of ornithine transcarbamylase into the cytosol। I'm not going into the detailed explanation of this beta, but at least try to understand this point that this Reye's syndrome, it is that we have discussed OTC enzyme in the urea cycle। बेटा आपको याद होगा हम लोगों ने डिस्कस किया था ornithine transcarbamylase enzyme in the urea cycle। That enzyme is mainly found within the mitochondria। Urea cycle first two steps are done within the mitochondria, but in these patients what happens, there is a damage to the mitochondria due to which OTC that was normally present in the mitochondrial matrix, it is now leaking out into cytosol and it is causing some pathogenesis। Just try to understand, this is the main pathogenesis due to the wrong location of the enzyme in cytosol। Normally it should be present in our mitochondria, but in this patient it will lead to cytosol। So just try to understand this question बेटा, इसका detailed explanation को जाने का जरूरत नहीं है। Just try to remember the answer is mitochondrial damage leading to escape of this OTC into the cytosol। ध्यान देंगे, we all know UMP synthesis in the pyrimidine synthesis, if it is decreased it will lead to orotic aciduria। This will lead to orotic aciduria। Please remember, ornithine transcarbamylase in the urea cycle, if it is deficient, then this leads to type 2 hyperammonemia। This leads to type 2 hyperammonemia, and carbamyl phosphate synthetase 1 deficiency in the urea cycle leads to type 1 hyperammonemia। So these are another 3 questions that might be asked in your exam beta। Try to understand option B, deficiency orotic aciduria, type 2 hyperammonemia is OTC का deficiency। Here there is not OTC deficiency, it is leaking from mitochondria, its original location from mitochondria to cytosol। That is the different disorder, Reye's syndrome। And type 1 hyperammonemia is the defect of the rate limiting enzyme deficiency of the urea cycle, that is the carbamyl phosphate synthetase 1 deficiency। So please remember these 3 questions also beta, ध्यान देंगे इस चीज को, try to focus on this। Yes, read it। Question number 15 जल्दी से देखते हैं बेटा, try to look here। Try to focus on this बेटा जी, ध्यान देंगे इस चीज को, राइट बेटा। Yes beta, you definitely are going to understand the subject of biochemistry। It is not that difficult। Try to focus here beta, ध्यान देंगे इस चीज को। Yes, waiting for the answers। 5-month-old child, chief complaints refusal to suck breast milk. Please try to understand. Although there is a mention of refusal to suck breast milk, there is also mention of occasional seizures and secondary hypoglycemia. On workup, there is evidence of metabolic acidosis with ketonuria, which is also reflected in the ABG analysis, and it is also confirmed by the urinary dipstick test. Further workup revealed to be a case of organic aciduria where one abnormal blood sugar smell in the urine is noted, my dear friends. I told you, long 1 kilometer long history. Look at the points that you know. ध्यान देना है, आपका नोन चीज से ही क्वेश्चन पूछेगा. This you know, abnormal burnt sugar smell in the urine, normal ammonia level in the blood, diagnostic modality that was used, burnt sugar smell in urine. We all know this is maple syrup urine disease. Maple syrup urine disease. Yes, this is due to deficiency of BCKD, ब्रांच चेन कीटो एसिड अल्फा कीटो एसिड डिहाइड्रोजनेस कॉम्प्लेक्स. ध्यान देंगे. एंड दिस बेसिकली डेफिशिएंसी वी आर गोइंग टू हैव ब्रांच चेन कीटोन्यूरिया. These branch chain ketones are the one that is reflecting ketonuria in the ABG also. It is being proved because there is metabolic acidosis that is reflected on the ABG, PCO2 high, POT borderline, and there is fall of the pH and also increase in the CO2. Bicarbonate will be low in these patients. Question they have asked, how do you diagnose? Which diagnostic modality? Answer my dear friends. Answer my dear friends. Yes, answer is B, डाइनाइट्रोफिनाइल हाइड्रोजन टेस्ट. बेटा इसको शॉर्ट में हम लोगों ने लिखा था DNPH टेस्ट. DNPH टेस्ट my dear friend, डाइनाइट्रोफिनाइल hydrogen test for the diagnosis. Yes, maple syrup urine disease. Important keyword, it will be there in this sort of question, that there will be. Please remember, this disorder also can be refusal to suck breast milk to some extent, but यहाँ पर हमारे पास कुछ और भी फीचर्स होते हैं बेटा, like occasional seizures, secondary hypoglycemia, metabolic acidosis, also ketonuria. These things are not seen in patients of galactosemia. Try to understand. We have just studied galactosemia, but I did not write these features. These are unique for maple syrup urine disease. ध्यान देंगे इस चीज को. And there was a big time hint, burnt sugar smell in urine. We have studied how to diagnose this. Benedict test is for what, beta ji? Benedict test is for reducing sugar. Benedict test is for reducing sugar or reducing substances. Reducing sugar or reducing substances. Ferric chloride test, it is positive in phenylketonuria as well as also in alkaptonuria. Please remember beta ji, ferric chloride test is also positive in these two. And cyanide nitroprusside test, cyanide nitroprusside test, it is positive in homocystinuria. Homocystinuria and normal cystinuria as well. ध्यान देंगे. So these are the tests that has to be remembered beta. One line question can be asked in your exam. Right? Moving to the next question. ध्यान देंगे इस चीज को. Try to focus. Look here. Yes, Kanupriya, you are right. Patient within the first week of life, it will basically present. Yes. Moving to this question, beta, ध्यान देंगे. Please try to understand. Try to focus here, beta जी. ध्यान देंगे इसको. Yes, waiting for answers. Yes, options are already coming. बट आई वांट द करेक्ट आंसर, करेक्ट आंसर, करेक्ट आंसर, करेक्ट आंसर। देखो लंबा चौड़ा हिस्ट्री दिया हुआ है, बट दे हैव आल्सो मेंशन्ड यू दैट कंफर्म द डायग्नोसिस ऑफ दिस, वी हैव स्टडीड दिस diagnosis of trimethylaminiuria. It is also called as this fish odor syndrome, my dear friends, and we all know this is due to deficiency of flavin containing monooxygenase 3. I told you, those of us who are mainly dependent on seafood, sea fish, if it is not cooked properly, trimethylamine that is found in the sea fish will not be converted to trimethylamine oxide due to deficiency of this enzyme. The job of this enzyme is to convert trimethylamine to trimethylamine oxide, because trimethyl oxide is in water soluble form that can easily go out in the urine without causing any bad odor. But trimethylamine, if it is passed as it is in the urine due to deficiency of this enzyme, it will cause fish odor syndrome. Yes beta, all of you have correctly answered this question beta. Yes, all of you have correctly answered beta. ध्यान देंगे, answer is C, this flavin containing monooxygenase. ध्यान देंगे. Try to look here. This first one, fumaryl acetoacetate hydrolase deficiency. This deficiency leads to type 1 tyrosinemia. This leads to type 1 tyrosinemia, where we have cabbage like or mushroom like body odor. Cabbage or mushroom like body odor. Cabbage or mushroom like body odor. ध्यान देंगे इस चीज को बेटा. Try to focus here. Rotten fish smell. Yes, yes, but here it is cabbage or mushroom like body odor. And homogentisate oxidase deficiency, my dear friends, it leads to alkaptonuria. 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 ध्यान देंगे इस चीज को बेटा. Alkaptonuria. Yes, yes, yes. Page 74 of our Biochem booklet. क्या बात है बेटा. Thank you so much. क्या बात है. Yes. ध्यान देंगे इसको. Yes बेटा. D amino acid oxidase is not much important in our human body beta. That is mainly for the bacteria. I will not go into that, but please do remember these three. First one, type 1 tyrosinemia, cabbage or mushroom like body odor, bad odor. In this one, homogentisate oxidase deficiency, all of you know, leads to alkaptonuria, those who black urine disease, cola colored urine, right? And this one is tried and tested, easy question, flavin containing monooxygenase number 3. F stands for flavin containing. This F is for vitamin B2. It is a B2 containing monooxygenase number 3. Moving to the next question. ध्यान देंगे. Try to look here. Yes. Easy question. Chocolate question. Chocolate question. ध्यान देंगे इस चीज को बेटा. Try to look here. Yes बेटा जी. Looking for answers. Yes beta. Looking for answers, my dear friends. Looking for answers. Yes beta. Yes, 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 all of you, my dear friends, have correctly answered this question. क्या बात है? Hats off to you, my dear friends. You guys are going to pass this upcoming 30th July exam without any doubt, my dear friends. Yes, this is FMGE question that may be asked in the exam. Yes, my dear friends. Yes, 6-month-old child. Basically presenting with fasting hypoglycemia. Yes. Further evaluation reveals there is a failure of carbohydrate metabolism, my dear friends, where the underlying cause is inability to both perform glycogenolysis as well as gluconeogenesis. Fasting hypoglycemia, first thing first that you guys should remember, this is most commonly due to von Gehr's disease. Mostly due to beta von Gehr's disease. Yes, वॉन गियर डिजीज, यस यस यस, ध्यान देंगे वॉन गियर डिजीज बेटा. And in von गियर disease, all of you know there is a deficiency of which enzyme beta G? That is a deficiency of glucose 6 phosphatase. Yes, in our liver. This in our liver will be basically missing. And this enzyme is the last enzyme for both these two pathways. ध्यान दीजिए बेटा, glycogenolysis as well as gluconeogenesis. Both these two pathways का जो last enzyme है बेटा, the last enzyme of these two pathways, it is same, that is glucose 6 phosphatase. Yes, very very important question. Please remember this beta, because glycogenolysis in the liver we need to go back till glucose 6 phosphate back to glucose. That is another reaction that is common also with the gluconeogenesis, when pyruvate is converted to glucose. That is also through glucose 6 phosphate. Glucose 6 phosphate was the connecting link of entire carbohydrate metabolism, and glucose 6 phosphate back to glucose problem will be reflected in two pathways: glycogenolysis in liver. This is glycogenolysis in liver, and also gluconeogenesis also in liver, my dear friends. So it is a liver enzyme, hepatic glucose 6 phosphatase. Von गियर disease deficiency will present with this fasting hypoglycemia. Yes, ध्यान देंगे, important point to be noted. ध्यान देंगे, yes, we also have those features: doll-like faces, lactic acidosis, those hypoglycemia, xanthoma formation, pot belly. All those things are pointed towards von गियर disease. ध्यान देंगे, try to focus. Moving to this one, yes, chocolate question. Yes, chocolate question. Yes, we can do it. We will do it. We will not make any mistake, my dear friends. Yes, look here. This question very easy. ध्यान देंगे. Try to look. Yes, beta. Try to look here. Answer, my dear friends. Yes, correct answer. I just now told the mnemonic also during our discussion. Just now told you the mnemonic, my dear friends. This is a picture of cherry red spot in macula. Cherry tree never grow tall in sands. So, Niemann-Pick disease, yes, we can see this. Gaucher disease, we can see this. Gaucher's disease, we can see this. Tay-Sachs disease, we can see this. And question is not seen. Don't miss this. Answer is Krabbe's disease. In Krabbe's disease, my dear friend, there is no cherry red spot in macula. Beta, ध्यान देंगे. Cherry tree never grow tall in sand. One more time. CRAO, trauma, Niemann-Pick disease, Gaucher's disease, Tay-Sachs disease, Sandhoff's disease. Right. ध्यान देंगे. Answer to this question is D, beta. Chocolate question, do not make any mistake in this one. I can see some C, but not the C, beta. Tay-Sachs disease also present with. Cherry tree never grow tall in sands. T stands for Tay-Sachs. So answer to this question is Krabbe's disease, beta. Question is not seen. Yes. ध्यान देंगे. Krabbe's disease, globoid body. Yes. Anudhashrini, क्या बात है? Yes, globoid bodies are also seen. Yes, in Tay-Sachs it is seen without organomegaly. क्या बात है? Naira, yes, my dear friends. ध्यान देंगे, right? Important point. Cherry tree never grow tall in stands. Another chocolate question, my dear friends. Another chocolate question. Answer, beta. Answer. Chocolate question, my dear friends. Yes, 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 yes. All of you are right. Yes, my dear friends. All of you are right. All of you are right. Yes. The infant is suffering from one of the following abnormalities is the picture depicted below. Which of this is depicted over here, my dear friends? Please try to remember, my dear friend. अगर आपको ये image दोबारा exam में दिख गया, close your eyes and mark the answer as oil drop cataract. Oil drop cataract. We have discussed during our today's discussion, my dear friends. Oil drop cataract. ध्यान देंगे इसको बेटा. Oil drop cataract seen in galactosemia. I told you the culprit enzyme name is aldose reductase. If they ask you cause of the cataract, aldose reductase. Which enzyme deficiency can lead to this? Then the problem has to be starting from our liver. Then we have those enzyme called as GAL1 put, galactose 1-phosphate utylyl transferase, or we can also mark the answer as galactosemia, how it is seen in the MCQs. So oil drop cataract beta, without any doubt, oil drop cataract. ध्यान देंगे बेटा. Oil drop cataract beta, deposition of the galactitol mainly or dulcitol that we have also written over here in our today's discussion. ध्यान देंगे. Snowflake cataract, my dear friends, it is mainly seen in diabetes patients. That is also called as diabetic cataract. That is due to deposition of the sorbitol. That is sorbitol. We have snowstorm appearance. Snowflake cataract, snowstorm appearance in diabetic. ध्यान देंगे बेटा. Please try to understand this. Moving to the next question. Yes, 3 image based questions back to back. 3 image based question back to back. Look here. 3 image based question. Three image based question back to back beta. Let us quickly look here. Beta, in Wilson disease we have those sunflower cataract. Yes, Rajendra, in Wilson disease we have sunflower cataract. Sunflower. ध्यान देंगे. That is a different question beta. Here we are targeting this. Yes, 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 yes. All of you, my dear friends, are coming with the right answer. All of you, my dear friends, are coming with the right answer beta. ध्यान देंगे इस चीज को. Please try to look here this. Hope there is no confusion. Yes, D. Everyone has marked the answer without any doubt. Answer is zinc deficiency, my dear friends. क्या बात है? Zinc deficiency, my dear friends, will lead to basically acrodermatitis enteropathica. Yes, the rashes around genitalia mainly seen in a infant. Please try to understand. It is zinc deficiency, and this disorder, my dear friends, we all know it is acrodermatitis. Acrodermatitis enteropathica. Acrodermatitis enteropathica, my dear friends. Yes, without any doubt. So these easy questions can also come. Some bouncers also we have discussed earlier. So please try to remember this. ध्यान देंगे बेटा. Acrodermatitis enteropathica, my dear friends. Right? ध्यान देंगे. Moving to 21. Chocolate question. Chocolate question for you guys, my dear friends. Chocolate question. Yes. Try to look here. Yes. 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 So many histories given, but I told you in the long histories, you need to find out the points that you know, that you have studied. Please try to understand this beta. कहानी बहुत कुछ हो सकता है. Don't get panicked. Maybe this much long info will not be given. Mainly will be given in 3-4 lines. But to give you this is to make you familiar with this sort of question beta. ताकि आप confused ना हो जाओ. Try to understand. From this unwanted kachra, we need to focus on the things that we know and that we can answer with. ध्यान देंगे. Yes, my dear friends. Yes, my dear friends. Yes, my dear friends. All of you are correct. All of you are correct, my dear friends. ध्यान देंगे बेटा. Please try to understand. It is a diagnosis of Wilson disease. It is a diagnosis of beta Wilson disease, and we all know. ध्यान देंगे. Most important point that we know is here KF ring. KF ring. That is the point we need to focus over here beta. KF ring. So it is a Wilson disease. ध्यान देंगे इस चीज को. That's why the answer to this question will be ATP7B. See, the history can be also framed like this beta. Please try to understand. In Wilson disease patients, we can also have difficulty in performing any work for the couple of time. Speech may be slurred and of low volume, they can't speak louder. There might be a limping type of gait. Slit lamp examination can reveal those KF ring due to the deposition of the copper we know in the decimate membrane of our cornea, Kecher's precious ring. If it is in the lens, that will lead to sunflower cataract, but here it is on the decimate membrane of the cornea, leading to KF ring formation. But they will also have normal visual acuity in these patients. Try to understand these points better. And LFT will show that increased ALT with the decreased serum albumin level, because in Wilson disease there will be hepatocellular degeneration, due to which it will be also producing low amount of albumin. Hepatocellular damage ho raha hai na beta due to this Wilson disease, so there is decrease in the albumin, as well as there will be more regurgitation of the ALT into the blood. ALT is a liver specific enzyme. As there is a damage of the liver, they are more leaking out into the blood. And USG can show coarse hepatic echo texture in the liver biopsy that can also predispose to cirrhosis. Please try to remember, all my dear friends, that Wilson disease, if uncorrected, then it will also predispose to cirrhosis. ध्यान देंगे, and this is due to ATP7B gene mutation beta. ध्यान देंगे इस चीज को. All of you have answered this one as this. ATP7A अगर पूछ लिया, this is Menkes kinky hair. This is Menkes kinky hair syndrome. ध्यान देंगे बेटा, Menkes kinky hair syndrome. Collagen 1A1 gene mutation. Collagen 1A1 gene mutation leads to again osteogenesis imperfecta. Osteogenesis imperfecta. ध्यान देंगे इस चीज को बेटा, osteogenesis imperfecta. This is a misprint over here beta. They should have given it as collagen 3A1. 3A1 is also seen in Ehlers-Danlos, but in Ehlers-Danlos most common collagen defect is the type 5 collagen, because collagen 5A1 gene mutation is the most common one. ध्यान देंगे बेटा, Menkes kinky hair syndrome, there is a failure of the copper binding ATPase in the intestine. There is a failure of copper transporter in the intestine, for which lysyl oxidase activity during the collagen synthesis will be defective. So weak collagen reflected in the texture of the hair, only in the hair. Menkes kinky hair, too much of excessive curly hair seen in this. Even that question also has been asked. There is a failure of copper transporter in the intestine. Yes. Try to focus on this question. So please try to look here at this question beta. Although the number of lines are less, but this is a tough question. This is a tough question beta. Please try to understand this. This is a tough question. We need to understand this slowly. ध्यान देंगे इस question को. Let me help you out over here. Let me help you out over here beta. ध्यान देंगे इस question को. Try to look here. Yes, correct answers are not coming. So let me pitch in and help you out. 4-year-old boy brought to the pediatric emergency with a sudden loss of consciousness in the school. Okay. CBG also showed RBS 56. So there is hypoglycemia and was immediately started on a bolus of D10. ठीक है. Later on workup revealed it to be a Typical case of medium chain acyl CoA dehydrogenase deficiency. Medium chain acyl CoA dehydrogenase deficiency. ध्यान देंगे इस क्वेश्चन को बेटा. Anil, you are right. Anil, you are right. Let me also pitch in and help the other students as well. Medium chain acyl CoA dehydrogenase deficiency beta. I told you this is the one of the most common inborn error from the fatty acid metabolism. This medium chain acyl CoA dehydrogenase enzyme, if it is deficient, then the medium chain fatty acids are not broken down in our mitochondria. And if they are not broken down, this acyl CoA or fatty acids, we all know, those are actually converted to acetyl CoA. Those are converted to acetyl CoA. But as there is this deficiency here beta, as there is this deficiency, so concentration of the acetyl CoA is going to decrease. Acetyl CoA concentration will be decreasing. ध्यान देंगे बेटा, if acetyl CoA concentration is decreasing, we have studied during our gluconeogenesis pathway that although acetyl CoA himself is never ever converted to glucose, but this acetyl CoA, my dear friends, is the allosteric activator. This is the allosteric activator of the enzyme pyruvate carboxylase. Pyruvate carboxylase. We have studied that allosteric activator of pyruvate carboxylase enzyme is acetyl CoA, and pyruvate carboxylase is that enzyme that will convert pyruvate to oxaloacetic acid or oxaloacetate, and this oxaloacetate, my dear friends, will further go for gluconeogenesis. So if we have a medium chain acyl CoA dehydrogenase deficiency beta, you are not going to get huge amount of acetyl CoA, and these acetyl CoA are normally important to activate the important enzyme of gluconeogenesis pathway. So अगर ये gluconeogenesis नहीं हुआ, then failure of which of the following enzyme explains the sudden hypoglycemia in this child? Please try to understand beta. I told you repeated time during our discussion that although acetyl CoA, ध्यान देंगे, although acetyl CoA is never converted to glucose himself, acetyl CoA खुद कभी भी ग्लूकोज नहीं बना पाएगा, but acetyl CoA is extremely important for gluconeogenesis pathway, right? Important point. So acetyl CoA is needed over here. Himself is not converted to glucose, but it is important for gluconeogenesis, my dear friends. ध्यान देंगे इस चीज को. And acetyl CoA production will be low over here, so gluconeogenesis is also getting low. So they have asked failure of which of the following enzyme action is the cause of this one. ध्यान देंगे बेटा. Answer to this question is pyruvate carboxylase. This is a tough question. Although only 3-4 lines are there in the question, but this is a tough question that you have to understand over here. All those long kilometer line questions were not tough. ध्यान देंगे बेटा, ये होता है bouncer. ध्यान देंगे, pyruvate carboxylase. Fatty acid metabolism enzyme defect will not give you acetyl CoA, for which your gluconeogenesis is getting affected, because acetyl CoA is the allosteric activator of pyruvate carboxylase enzyme. But we have studied this point in our classes at MIST, right? Important point, इसको ध्यान देंगे. Yes, ध्यान देंगे. Yes, pyruvate carboxylase. Yes, beta. Pyruvate carboxylase. Please, please, please read the questions carefully. Read the questions carefully. ध्यान देंगे बेटा. Pyruvate carboxylase. Moving to the next question. Yes, look here. Look here. Yes, beta. Right, beta. Look here. Chocolate question. 23rd chocolate question. Chocolate question, my dear friends. Chocolate question. Yes, Kanupriya, you are right. Yes, yes. Now the answers are coming. Few of you are answering A. Why A, beta? Why A? Why there is confusion? No confusion, beta. No confusion. Phenylketonuria will not be presenting that late. What is the age of this patient? 40 saal. 40 saal, 40 years. Alkaptonuria for adults. First hint. Do not even look at phenylketonuria, my dear friends. ध्यान देंगे बेटा, please try to look here. Let me help you out. 40-year male, low back pain, teaching for long hours like us, thinking common due to nature of his assignment but recently has become unbearable. X-ray lumbosacral spine, my dear friends. So zone of calcification. Lumbosacral spine is the most common area in the vertebra where there is deposition of the alkaptones. This is a part of oochronosis, my dear friend. And metabolic disorder is suspected, refers to the case to biochemistry department where surprisingly Benedict test comes positive. Okay, why Benedict test come positive, my dear friends? We all know in alkaptonuria, homogentisic acid that we have, this homogentisic acid, my dear friend, it is also a reducing substance. This is also a reducing substance. ध्यान देंगे बेटा, this is also a reducing substance, homogentisic acid. And I told you Benedict test is not only positive for reducing sugars, also for reducing substances. Yes, my dear friends, important. Reducing substance. ध्यान देंगे इस चीज को बेटा. That's why Benedict test also comes positive in patients of alkaptonuria. I have taught you 3 urine tests, beta. Alkaptonuria diagnosis is not done by blood test, it is done by urine test. We know urine color changes to cola, then to black with time on standing. Then we have discussed about those cola color urine, those changes. We have also discussed about ferric chloride test. Today also we have discussed ferric chloride test is positive both in phenylketonuria and an alkaptonuria. And also remember homogentisic acid is reducing substance, and that's why, my dear friends, we have the Benedict test also positive over here. And the diagnosis of this disorder, my dear friends, without any doubt, alkaptonuria. In phenylketonuria, you are not going to see any calcification in our intervertebral discs. ध्यान देंगे, this is an important point. I told you it is not known to many clinicians in India because this is an important disorder mainly seen in adult patient. By the age of 40, presentation है ना मेरा, we have studied about 3rd or 4th decade of life, right? 3rd or 4th decade of life. So by this we can easily rule out mainly phenylketonuria. Phenylketonuria MCQs in your FMGE exam mainly will be restricted to pediatric age. ध्यान देंगे इस चीज को. Most likely diagnosis. Try to focus here. Second last question beta. Second last question. ध्यान देंगे towards this. Yes, Kanupriya, you are exactly right, beta. 3rd or 4th decades. Anudha Srini, yes, 3rd or 4th decade of life. Now coming to the new question. New question. Important point, इसको ध्यान देंगे बेटा. I want answer to this question. I hope all of you can answer it clearly without any doubt. Without any doubt. They have asked what is the most likely diagnosis. ध्यान दीजिए. Try to focus. Yes, waiting for answer. We have discussed this question. This is actually a chocolate question. Chocolate question, my dear friends. Chocolate question. Oh no 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 no, you guys are answering it wrongly बेटा. गलत हो जा रहा है बेटा. ध्यान देंगे, ध्यान देंगे, ध्यान देंगे, प्लीज ध्यान देंगे. इसका आंसर सी नहीं है. नो 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 बेटा, नो नो नो, दिस इज नॉट सी बेटा. यस, द आंसर इज एक्चुअली ए. We have discussed this question in our biochemistry class, my dear friends, multiple times. Don't get trapped. Don't get trapped by looking that the elder brother also faced similar finding. I know why you all are targeting the word familial combined. Familial combined. See, familial is also a word given over here, beta. Also familial word hai, because it also runs in families. This also runs in families, right? Both of them are running in family. But in combined hyperlipidemia, my dear friends, there is also rise of VLDL. But in primary familiar hypercholesterolemia, my dear friends, there is rise in the total cholesterol level that is mostly secondary to LDL rise. We all know LDL should be kept as below 100 in our Indian population. But if there is a rising of the LDL level, I taught you this, my dear friends, that primary familial hypercholesterolemia, it is actually the most common. It is the most common one. Most commonly you should answer most common questions. Try to understand. ध्यान देंगे. This is the most common type, my dear friends. Most common. So what happens, beta, in this disorder? There is a deficiency of the LDL receptor. In primary familial hypercholesterolemia, there is LDL receptor deficiency. LDL receptors are absent. That's why LDL is not getting uptaken properly, and that's why too much of LDL will be present in our circulating blood and LDL will be rising much. That's why there is a high chance of atherosclerosis, for which there is predisposition to those ischemic heart disease as well as in myocardial infarction. And this sort of things also runs in families. I taught you this, beta. This disorder is mainly of autosomal dominant type. There is a positive family history, and usually the age group beta, middle-aged male, basically usually death by second or maximum by third decade of life. Yes, we have all those things called as corneal arcus. We have tendon xanthoma over our tendo Achilles as well as over the knuckles of our hand. We also have near to the inner canthus, upper and lower border, we also have LDL depositions. Those things are called as xanthelasma. Those things are also seen in patients. यहाँ पर main चीज जो ध्यान देने वाला बात है बेटा, most fatal one is the one. This is the most fatal one. बेटा, most fatal one. ध्यान देंगे इस चीज को, and that's why there is a history of deaths in the family. Elder brother also died due to this. This guy is also in danger. ध्यान देंगे इस चीज को बेटा. So important point, ध्यान देंगे. Most common type is also the most fatal type. जो most common है वही most fatal भी है in the group of Frederickson-Levy-Lees classification. But this classification does not include any disorders related to HDL. ध्यान देंगे इस चीज को बेटा. Try to focus here. So there are three features of breathlessness, shortness of breath, chest pain while climbing stairs. Try to understand this, because all this is due to the too much rise of the LDL. So LDL should be brought low, right, my dear friends? A beta lipoproteinemia, we have acanthocytes. Familial combined hyperlipidemia, we have two things rising together. Actually three things rising: LDL, IDL and VLDL. LDL, IDL, VLDL, all three will rise. That's why the word is combined. But in primary familial hypercholesterolemia, there is mainly rise of LDL, that is most life-threatening. And Tangier's disease, my dear friend, it is hypo-alpha lipoproteinemia. Please remember, in Tangier's disease, we have also discussed, this is very much low level of HDL. Very much low level of HDL, my dear friends. Very much low level of HDL, and they will also present with orange yellow tonsils. Yes, all of you have correctly pointed out, beta. Rajendra, you are right. Please try to understand. ध्यान देंगे, primary familial hypercholesterolemia, it is also denoted as the type 2A of hyperlipoproteinemia classification. Type 2A, type 2A of hyperlipoproteinemia classification. We have this primary familial hypercholesterolemia. ध्यान देंगे इस चीज को बेटा. Try to focus. Yes, orange yellow tonsils can be also seen in Tangiers disease. As HDL is too much low, so LDL will take the upper hand. In this disorder also, too much rise of LDL is also seen. ध्यान देंगे. Try to understand, but this usually doesn't run on families. Try to understand this. ध्यान देंगे. Coming to the last question. Yes, Khan, you are exactly right, beta. क्या बात है. ABC, ATP binding cassette transporter protein 1 deficiency or defect leads to this. Yes, all of you are right, beta. क्या बात है, Khan. Yes. Great answer. Yes. ध्यान देंगे. Coming to the last question. From my side, beta. Almost at the end. Finishing the question with a bang. All of you know this is an expected question and most likely it is going to come. So this question, hope there is no doubt and you all can answer this question correctly without any doubt, my dear friends. ध्यान देंगे इस चीज को बेटा. Try to focus here. Answer. Siddharth, Kanupriya, right. Medvision, Aishwarya, Anudashrini, Rani, as well as Ekta, Sanjay, Karishma, Akash, Anil, Dr. ICU, Vijay, Rani again, Manasa, Kamali, Kanupriya one more time, Khan, Santosh, all of you, my dear beloved students. Yes. Without any doubt, mark the answer as vitamin B12 or cobalamin. Most important one, because urine for methyl malonyl CoA was also elevated. So this answer will go for vitamin B12, my dear friends. Hope there is no confusion in this sort of question. Same type of history. Urine methyl malonyl CoA, if it is normal, then the answer will go for folic acid, beta. ध्यान देंगे, folic acid में it is normal. Methyl malonyl CoA is the differentiating feature between folic acid deficiency and vitamin B12 deficiency. We have discussed this sort of question multiple times. Please try to understand. 12 bleed ACG also tried to show that there is an old infarct, my dear friends, in the anterior wall of the heart, because we have also discussed that in B12 deficiency there is a high homocysteine level, and as there is a homocysteine level, my dear friends, there is a higher chance of accelerated atherosclerosis, and that's why the patient also had an early attack of heart attack in the anterior wall of the heart. But the differentiating feature is mainly methyl malonyl CoA. So I hope that all of you, my dear friends, can keep these concepts in your mind. We have studied few things new today, and we have also learned in a long type of questions how to point out where to look for the most important ones, my dear friends. So important points, please remember, methyl malonyl CoA elevated in B12 deficiency, normal in case of B9 deficiency, my dear friends. So with this, we basically finish off today's this session, and I wish you all the very best, my dear friends, and I also pray to God that all of you can come out with flying colors, my dear friends. May God bless you all, and may every one of you pass. Whatever days have happened, no matter from where you are coming, we are all welcoming you to practice as a doctor in India, and always keep your benchmark very high and also keep your morale very high. Stay elite focused, stay motivated, and few more days to go. Keep your focus very high and stay with the positive attitude, and my dear friends, God will definitely bless you with success. Will definitely bless you with success. So may everyone, all of you, pass this upcoming exam of FMGE. Thank you all for giving me a patient hearing, and thank you all for being here in the night as well. Thank you all. Goodbye to all of you, my dear friends. Praying for you, and wish you a very, very, very good luck to all my friends.